Nurses do not diagnose medical illnesses. We diagnose the human response to that medical diagnosis. If you chose to work in a nonprofit healthcare organization or in rural America, they paid off your student loans for it. I worked night shift for the first year out of nursing school. It was absolutely fabulous. I loved it. I made bank. I paid off student loans. We got married. We had money to blow. I'm not eligible for a lot of grants because now I have this great income. And so my hospital system helped pay for my bachelor's degree to deal with death on a day in and day out basis. And this was a huge problem during COVID. Nurses were experiencing death so frequently, it was an emotional overload. And I can't tell you how many times we've cried in a break room, and we do cry in the hallway, but you have to find a way to put yourself together because you're there for the family. It's not about you. And the ER is just, you don't know if you're going to have a 100-year-old patient or a one-day-old patient. You don't know if your patient's going to be able to tell you what's going on or if they're going to be unconscious. We do things for them physically that they would never want their spouse or a loved one to do for them. And you have to be able to be empathetic, but you have to be able to also put walls up to protect yourself. Nursing is a team sport. And when I say team, it's teams of nurses, it's teams of interprofessionals. We work together as a group of people. The reason that nursing schools have started putting that into the curriculum is because we learned that students who pass have generally taken 5,000 questions or more. Required in the state of Virginia and in most states, 500 hours of clinical experience.
You said that there's a really large demand right now for nursing.
There is, yes.
So
because of the shortage, you're seeing a lot of facilities also offering sign-on bonuses. Always, as a new grad, when you go for an interview, ask for a tour of the unit and then ask if you can speak to a nurse.
how much money does a registered nurse earn when they start, as they progress? How much do they earn?
So a lot of times at higher acuity areas, the nurse makes more money.
Welcome everybody to the My Career Shop podcast, where on each episode, I get to speak to people from different careers and professions so you get an idea of what actually happens in the day-to-day of different careers to help you find out if this career is the right path for you. Our guest for today is Dr. Akers, who has an incredible amount of insight to offer with respect to the nursing profession. She has an associate's degree, a bachelor's degree, a master's in nursing, a master's in business administration, has a postgraduate as an educational specialist, and a doctorate in education with a couple of additional certifications as well. In addition to all of that education, Dr. Akers has a great amount of experience in the field as well. And on today's episode, we will be discussing how to become and the various paths you can take to becoming a nurse, the NCLEX, and tips of how to study and pass the NCLEX, what a nurse does on a daily basis, their income, the impact COVID had on nurses, what a nurse practitioner does, the impact of AI on the field, and much, much more. So if you're interested in becoming a registered nurse, tune in for the rest of the episode. Hi, Dr. Akers. Thank you so much for coming onto the My Career Shop podcast. Very nice to have you here.
I'm excited to be here and share the opportunity of nursing to so many of your listeners.
Yes. So you already burst my bubble. We're here to talk about the profession of nursing. I had the opportunity to research you obviously before this, and based on your profile, you have done a lot.
Yes.
And so nursing is just one of many things that you've done. You've been a professor, a service line director, a dean in academic affairs. And it's awesome to see that you went into a profession, weren't pigeonholed, and somehow had the opportunity to, delve in so many different things. Now you're on a podcast.
Yep.
So first and foremost, congratulations on an amazing career to date.
Oh, thank you.
I'm pretty sure it's not even over. So
I hope
kudos
not.
to everything in the future as well. And so thank you very much for coming. And so, I just gave a very brief overview. Can you tell our guests a little bit about yourself?
Absolutely. So, one of the things about nursing, it has always been the foundation of what I've done. So I went to nursing school when I was 18, and it really set that foundation of my future. Whatever that future was going to be, I knew it would still involve nursing somehow. So I became a bedside nurse. I worked in cardiac ICU. It's my favorite place in the world to go. I love adult patients. I love having that opportunity to make lifestyle changes and talking them through that. So I love the cardiac system. Everything else is wonderful too, but the heart is just the heart of nursing, in my opinion. A little corny, but I do love that heart side of things. And so I've used that. When I went into leadership, I became a manager. I've done education in the hospital. I also always generally stuck in the critical critical care and emergency areas. The joy of being a nurse is, like you said, you're never pigeonholed. If you are to a point where you just want to learn something new and engage in the learning process, you pick up something new. And so as a cardiac ICU nurse, I've also worked in the emergency department. I've worked in surgical trauma ICUs. I've worked in neuro and medical ICUs. I've worked in the neonatal ICU. I've done a little bit of everything. I've never delivered babies. And I don't take care of kids. At least I try not to take care of kids. Kids are so special, and they don't really know how to communicate. And I really like that adult who can communicate very well. So that's always been a joy, is I love those adult patients. So I, did the service line director role, which you mentioned, and that was over a cardiac service line, 17 departments, everything from EKG and echo to the open heart surgeon's office, and worked everything in between. So it was this amazing experience of learning about marketing and advertising and community networking and relationships. And you still had the patient care aspect. I still attended major events that happened on my areas. I was still engaged in caring for patients on odd hours. Somebody needed a vacation day and we couldn't find anybody to work. I put on a pair of scrubs and went to work. And that was the joy of being in that. When I moved over into academics, it was a completely new role where now I'm teaching the next generation of nurses. And I found that to be really great for me because I was able to mentor, able to guide and give assurances, encourage, sometimes pull people back a little bit and sometimes push them forward. I'll never forget, and you'll get a kick out of this. I had a student, one of my very first clinical rotations was with incoming students. So these were sophomore level, first time in the hospital students. And I had only been on the floor like twice. So it was a brand new place for me, new organization, new unit. And the students were all standing out in the hallway. And I kind of, came up next to them and I said, "What are y'all doing? How's it going?" And they're like, "Well, our patients are sleeping." And I said, "You have to wake them up." And they were like, "Oh, we can do that?" And I'm like, "Yeah, you got to wake them up. You still got to do what you got to do." And so sometimes it's that little gentle push into the room because they're scared that first time.
You don't know boundaries whenever you start a profession. Right? I mean, I struggle with that in the beginning in my career as well. Yep. And so I guess that's the version in nursing, right?
It is. It's, can you wake them up? Can you ask that question? Do you have to say yes? Can you tell them, no, you can't eat? How do you tell someone who's saying, "I'm starving to death"? "I'm sorry, you can't eat. You have surgery in an hour." It's walking those thin lines of that, what we would typically call softer skills, become very hard skills in nursing. It becomes what you have to do on a daily basis.
Fair enough. So I don't know if anyone knows what a service line director is.
Okay.
So, I mean, I know today we're going to be discussing the profession of nursing,
right,
but our audience is typically somebody who has not been in the nursing field.
Sure.
So can you just give a brief overview of what is a service line director?
All right. So as service line director, it's really a director role, so a management and supervision role over a large portion of an institution. So in this specific facility, they had a service line director who handled all things cardiac at 2 different hospitals. So we were 7 miles apart. It wasn't that far away, but you handled the cardiac services at either facility, whatever that entailed. So anything that had a heart attached to it, anything that said cardiac, it was mine. We also had like a maternal child service line director. You had a med surgeon telemetry service line director, emergency services. So each area, it's like a group of similar or like-minded areas that a patient might come into contact with consistently. So mine being cardiac. So a patient coming in who's having chest pain, one of the first things we're going to do in the ER is get an EKG, electrocardiogram. We're going to look and see what's that electrical activity in the heart looking like, and it helps us determine if the person's having a heart attack. Well, if it's a no, then we're going to watch them and test and see what's going on and why are they having this discomfort. But if it's a yes, they need more testing to determine, are we going all the way through all of these cardiac potential services? And cardiology is a huge field. Everything from EKG and the echo, where we're doing an ultrasound of the heart, to the cardiac cath lab, where they're going in and taking fluoroscopy pictures of the heart through the chest wall using dye, to stents, and you've heard of aortic balloons, all of these different things that we can do, and leading into the OR setting where someone's having maybe a valve replacement or a bypass surgery. And then when you get them out of the hospital, they go into cardiac rehab. So you have this wide variety of things that are cardiac related throughout the hospital system. And where I was working in that role, I managed all of those areas. So that entailed making sure that we had the right staff mix, making sure that we were hiring the appropriate minded people who were qualified and educated and who lived out the mission of the organization, making sure that people were evaluated, and if they needed additional training, working with the managers to make sure that that happened. We were engaged in advertising, so you have a huge billboard dictating cardiology of anything in that hospital system. I had to approve it and review it and make sure that it met standards. We did the advertising. We did a lot of work with the community, and that was really a love of mine. And I think education has always been in my bones, and I've always enjoyed teaching. So some of the things that we did, I did a cardiac breakfast for men because it was a 7 a.m. Guys could going into work or into class could come in. We had breakfast that was a healthy breakfast, and would do a lecture on a cardiac disorder that was common among male population in our region. We did an afternoon tea time for the ladies, same kind of concept. We picked different times of different days just to try to get engaged more people. But cardiac problems are different in males and females. And so it was a really great opportunity to hone in on specific populations and have those deeper conversations that are very specific to what they need, whether it's the medication, whether it's the dosage, whether it's the diagnosis. We could teach the population about that. So when I said everything from start to finish, it's budget, it's marketing, it's the business side of it, as well as the customer service side of it.
Okay. That makes sense with the title director.
Yeah.
So how many years were you a nurse before you became a director?
Okay, so I have been a nurse now almost 28 years. We're getting closer to my 28 years here. I had been a nurse for 6 years when I moved into a management position. I had been in management for another 5 years before I went into that director role. So about 11 years, give or take.
So when was the last time you would say you were on the front lines?
On the front lines full time, and that's all I ever did. It's been a long time ago, like 21 years. Now, that doesn't mean that I didn't pop in and take care of patients. So the whole time I was a manager, I would fill in for my team if they needed to go to lunch, if they needed a vacation day, and I'd pull the entire shift for them. I was a very big proponent in patient, even in self-care, even back as early as the early 2000s. And my organization I worked for was very supportive of that. So for an example, we had a nurse who lost a loved one in a tragic accident. And several of the nurses on the floor were her best friends. They did life together. And so they all needed to be off for the funeral. We didn't want it to just not be represented there. While this was one of my dear nurses who I had worked with for years, I knew it was more important for her that one of the other members attend her funeral. So I picked up the shift and worked the entire day so that her friend could be at the funeral to support her. So as a leader, you're still engaging in that patient care. When I went into academics in 2009-ish, I did clinicals in the hospital, and I worked on a as-needed basis for the hospital. We call it per diem, or you'll hear PRN. And so we worked and would pick up shifts sporadically for the hospital in the medical ICU. And I would work with students, and that's always fun too. So even the students are there, they're still your patient. Always the instructor is elbow deep in the patient care.
Cool. So your journey began as a nurse.
Yep.
Then you went service line director, and then you went into academic affairs.
Yes. Yeah.
Okay. So why did you want to become a nurse?
I made the decision to be a nurse when I was 15 years old because I was a patient. I had a emergency surgery, had to have an appendectomy, and had a not so great experience all the way around. 2 weeks later, they had found a growth, and they needed to go in and do another surgery. And that experience was absolutely phenomenal. The surgeon was the exact same person. The hospital system was the exact same person. The only difference in the 2 stays was the nurse who took care of me. And that made a big difference, and it made an opinion. It set really hard in me that as a single person, I can make a huge difference in a life. I also have an aunt who is a nurse, and so she had told me all of her wonderful stories. She's an E.R nurse in a level 1 trauma center in Louisiana, and I would hear all of her stories growing up, and so that was always an interest point. But at 15, I made that decision.
Oh, wow.
Yeah.
Okay, so 15, you decided this.
Yep.
And then you went where? So for the next question, I would just like to discuss and you're in academic affairs.
Yes.
So this is something you're intimately close with.
Yes.
What are the prerequisites in order for someone to actually become a nurse.
Absolutely.
And we'll talk a lot about this because the nursing profession seems to have multiple routes to getting
Yes.
to the same
Yep.
exact place. So I was researching online and it said you could become one in 2 years
Yep.
or 4 years. So can you take me through, let's say somebody just came out of high school.
Sure.
How do I become a nurse and start tending to my first patient?
Absolutely. So nursing, you're right. We have a variety of ways to get into the profession. And once you're in the profession, it opens up a massive amount of doors of opportunity. And that's one of the things that I've really enjoyed about it, because I could learn so much and I could engage in so many different things. To become a nurse, if I was an 18-year-old graduate from high school, and I found a great nursing school. So the first thing you've got to do is go to school. You have to have a degree in nursing to sit for state boards. Once you have your degree in nursing, you can sit for your licensure exam. We call it NCLEX, and it's the national exam that we take all across the United States as well as Canada. So, which is really great.
I'm Canadian, by the way.
Are you? Okay.
Yeah.
Well, welcome home. This is a great place for Canadians. We have a lot of friends here who are from Canada. One of the wonderful things about the NCLEX is once you take that test, it's not like in law where every state has a different bar exam, right?
Mhm.
In nursing school, it's the same test, and you're able to take it wherever you want to go.
I would hope so. It's the same body, you know?
The liver is still right where the liver was
Yeah,
left,
exactly.
right?
No,
Yep.
that California liver is different. But okay, so you get a degree,
Yes.
right? So
Yep.
it's a bachelor's of.
Well, you can get a Bachelor's of Science in Nursing or a Bachelor of Arts in Nursing, depending on the school that you go to.
Okay.
Most schools are science now. It used to be more of a Bachelor of Arts degree. It has shifted in about the last 15 years to that science mode, maybe 20 years even, into that science mode, as we have really been delving into nursing as a science and not just an art. You can also get it through an associate's degree, usually a science as well. You can get it in some places. They have a diploma program. That is rare. It is going away. It is probably, I'm not even sure that there is one within the local region. I can tell you there's not one in where I'm at anymore. Most of our diploma programs were hospital-based, where the student stayed at the hospital and worked at the hospital, lived at the hospital, usually like in a wing or in a dorm there. And this was very, I would call it old school. We don't typically have very many of them anymore. Great programs, lots of hands-on experience. It's usually a 3-year program, and it's all about nursing care. So it is all about the hands-on, practical, technical side of nursing. The associate's degree is generally at a community college, or now it's diploma programs that have shifted to an associate's degree, and it's a 2-year program. I actually started with an associate's degree, and I went to a university in Louisiana, and that's where I attended because it was a great school, and it's still a phenomenal school. And I got 2 years of science-based classes, nursing classes, and your general associate degree level general education courses. And then you have the opportunity of a bachelor's degree. So the bachelor's degree is your typical 4-year. I always say some students like to turn it into a 5-year plan, but it's generally 4 years. It is all of those liberal arts classes. It is additional coursework that are above and beyond the associate or the diploma. So there are some classes in the bachelor's program that are more specialized for that higher practice level, like research and community care. Whereas in an associate's degree program, it is very hospital, a very set population. So you have the typical adult care, pediatrics, mother, baby, and psychiatric nursing. When you move into that bachelor's level, you can actually delve into larger populations. And so that's where you get into that community is held for that baccalaureate, as well as research and leadership classes. The intent originally was we have a huge national shortage, and this was back in the 40s and 50s. And so we had this associate's degree come in, and wonderful degree. It's where I started at. Most nurses who are probably a little older than me, that's what most of them started off with, was an associate's degree. The younger now are more bachelor's prepared, which is a great thing because it brings it up a level. I am a proponent of learning. I love the associate's degree, so I would never want to tell anyone not to do that path. But we have proven, the Institute of Health and magnet status organizations and several have proven that the more education a nurse has, the better are her patient outcomes or his patient outcomes. So we've seen a huge trend towards higher education for nurses towards that bachelor's, and now we're even pushing towards master's entry. So there are some universities that offer a master's level entry into nursing, which is yet another path that has now been a newer path.
Okay, so that was
That's
a
a
lot.
lot. Yes.
Yeah. So I got 3.
Okay.
Right? Associate's degree, you can go via community college.
Yep.
That's approximately 2 years.
Correct.
And then there's the bachelor's program.
Mm-hmm.
And the bachelor's program is your typical 4-year
Yep.
Bachelor of Science. They're phasing out Bachelor of Arts.
Mm-hmm.
And you get that. The third one, which is almost completely phased out, but in Canada
still
and
have a
America,
few
there
of
might
them.
be a few of
Mm-hmm.
them, is the diploma program, which is an incredibly hands-on, less theory. And
Correct.
you're probably just interning for 3 years, it seems
Pretty
like.
much. Yeah.
right?
No, there's still coursework, and they still hit those main nursing classes like the associate's degree. They don't do community. They don't usually do a true, what we would do, leadership theory classes. They're not going to do a lot of research. Maybe more of, reading research and applying it to your practice versus the actual doing of research.
Okay. Can you start a Bachelor's of Science degree and then later make your decision to go into nursing?
You can. Some schools actually require you to start and do a first year before you can apply to get into the nursing program.
Okay.
So there is that possibility. However, because nursing is known to have a very hard curriculum, you have to start early on in a lot of those classes. So before you can get into a nursing program where you're actually taking hands-on, taking care of patient classes, typically students have to take a pathophysiology course, medical terminology, but they also have to have the biology and the chemistry and the anatomy and physiology that all come before all of that. Excuse me. So we highly recommend that if you know that that's what you're wanting to do, you've got to start off on that pathway. We do have students who get in year 1 and decide, I really didn't think I was going to like biology, but look, I like biology. And so they start to delve into it. Sometimes those are the ones that tend to take a little bit longer route. Mainly
That's the
because,
victory lap.
Yeah, exactly. Mainly because they just didn't know going into it.
Okay. So you said second year, you pretty much have to decide. Well, I mean, I'm pretty sure you can do your second year and then apply
sure.
for the nursing.
Yep.
But I mean, in the event you don't want to pay fees forever.
Exactly.
So the actual nursing program is 3 years after general Bachelors of Science.
Schools can be different. So
Yeah.
some schools have the actual nursing courses in 3 years, so sophomore, junior, senior. Some universities actually do it in 2 years.
Mhm.
So they get a ton of those general education courses done early on and then use those final 2 years to do just hard and heavy nursing. So you can see it
Okay.
both ways. It depends on the school and their mission and their vision and what their goals are and how they want to create that curricula.
Okay. And I mean, I don't need you to list out everything, but do you have a general idea of what type of courses you would get just in the nursing portion? Because
Absolutely.
you went into the prerequisites, so you need pathophysiology, biochem.
Yep.
What about the nursing part? Because you mentioned leadership and things of that nature. That's probably a blemish of the Bachelor of Arts still coexisting.
Yes.
Right? So what does, you said typically
Yep.
it's a Bachelor of Science now, it's not a
Yep.
Bachelor of Arts anymore. So what are those courses that
Yeah.
they're
Every nursing program has a fundamentals, or you'll hear nursing call it fundies. So it's our fundies class. It is the class where you learn sets of skills. So how do you take a blood pressure? How do you appropriately take a blood pressure? Most people don't know that you're supposed to sit up, arm at chest level, feet flat on the floor. So it's learning those little tricks of the trade that get you the most accurate assessment. In fundamentals, they may also learn how to do injections, how to give medications. It's the skills, those technical skill sets. Most schools have a health assessment class. Health assessment is learning how to do a physical on a healthy adult so that you know what to find when you see something that's not normal. So if you're assessing, and usually it's classmates or roommates or colleagues or friends that you're learning to assess. We laughed over COVID and people were using teddy bears to show the appropriate location of a stethoscope. Not really high tech in a lot of ways, and so we wouldn't necessarily recommend that. But it is a lot of fun that you can be creative creative when we had to be. So health assessment learns that type of skill set of learning that assessment. Then they move into those higher level courses. So some schools have research at a sophomore level, some do it junior and some do it senior. So it depends on the level of research and the type of research they're requesting and requiring their students to do. They will also do an introduction into the nursing profession. So sometimes they call it a professionalism course or like a nursing 101, where they're learning all the what do we do with nursing? What are the theories of nursing? What are some of those foundational cores? We call them the meta paradigms of nursing. What are those, and what do we mean when we say that? Once they get into higher level classes, everybody does med surg. That's a typical adult medical surgical patient in the hospital. We also do mother baby. So they do labor and delivery and OB and newborn nursery and or NICU, the neonatal ICU. They will do a pediatrics course. Everybody has to learn how to take care of little kids at one point or another. And then they don't, like me, they never want to go back to doing that again. Kids scare you, they just do. My kids are fine. Everybody else's kids scare me. So then you also do psychiatric nursing, because we all have different mental health and emotional health needs. And it's great for a nurse to be well-rounded. And that psychiatric course is where you're delving really hard into the psychiatric disorders. And what do we do as nurses to help support the patient during that time? And how can we see a problem, and how can we intervene in a problem? And then how do we evaluate our actions, right? And so we're able to take what we learned in that psychiatric class and apply it across all of the things that we do in nursing. And so many schools will also have a critical care class. Some of them call it like an advanced med surg, but they're focusing on that critical care patient, that ER patient coming in a moment of trauma, perhaps. Many classes have community, where they're going into their community and serving. Sometimes that community is the university campus itself. During COVID, we had our students shoot videos on how to wash your hands that would be fun for college kids to learn. It's super simple ways of impacting the community in which you live. After COVID, and before COVID, we did a lot of things with maybe the homeless population in our region. We've actually taken students, I've taken students across the world. We've gone to Rwanda, we've gone to Kenya, we did Guatemala, we've done all kinds of different places, teaching students that what we see as nursing care in the United States isn't what is always nursing care in another country. And it's important if students are planning to travel, that they understand that. And so a lot of nurses do medical missions. That's kind of core about what we like to do, is help people and help communities. So it gives them a chance as students to take care of that. There's also electives that you can choose that kind of give you the opportunity to explore deeper something that might be really interesting to you.
I'm just interested in what we have to do
Absolutely.
because most bachelor's programs give you that opportunity. It's more like we're just concerned about nursing.
Those core classes, yeah.
So that was quite a bit.
Yeah, there's research out there that says that nursing is the hardest undergraduate program, because on average we have more exams, the clinical component, and the number and type and the depth of the courses that are required. It's a hard degree.
I mean, you said that there's a really large demand right now for nursing.
Yes.
So they should maybe chill out on those requirements and make it slightly easier.
As long as they are competent when they graduate. We just
Exactly.
want, it's like I used to say, I want students, when I wake up in the hospital, because I'm sure at one point or another I'm going to be a patient, or a family member will be, I want to open my eyes and see that nurse and say, yes, that's a good nurse, right?
Fair
and so
enough.
you don't want to wake up and say, ooh, not such a great thing, right?
Yeah. So, okay, that was awesome. Thank you so much. That was
Sure.
a lot of information.
Yes.
I think everyone knows at least what to expect in university.
Mhm.
Now, before we move on to the NCLEX you called,
Mhm.
is there an advantage to doing an associate's degree versus a bachelor's degree?
Absolutely. So there are some differences. One is the time frame, associate degree being 2 years on average, and a bachelor's being 4 years. As a 2-year graduate, you can get out and pass NCLEX and start working while you go back to school to finish your bachelor's. And so you
Okay.
have that benefit of being able to work while you're in school finishing up your degrees.
But if it's one of the most competitive and
Mhm.
difficult undergrads,
Mhm.
I mean, you're pretty much signing up for a really tough 2 years.
Yes. The tough part, though, is those clinical components, which you're getting the bulk of those clinical components in that associate degree program.
Okay.
So what you're taking are those theory classes, the leadership classes, the community, the research, those higher level classes that are a little bit different and less, it's a different type of demanding. So it's more intellectual demand than time demand in a lot of cases, if that makes sense.
Not fully yet. I can't see the picture, to be honest. So associate's degree, you do your 2 degrees, then you write your NCLEX, you get your license,
Yep.
you're a full nurse at that point, and
You're
then
a registered nurse.
and then you're getting paid money,
Yes.
and you
You're
still
taking care of patients.
yeah.
You're working your 40 hours or your 36, whatever your schedule has. You are living life, and you are doing school on a part-time basis.
And so how long do you think average nurses take for the latter 2 years?
It depends on what was required in their associate's degree program. Everybody's a little bit different, so not every program is the exact same. I'll give you an example. In my case, I was required to have X number of sciences in my associate's degree program. I had to have 1 more credit to fulfill the needs of that science course in my bachelor's class. So I went to the local community college and did a biology lab for a semester and got my 1 credit and added it in and was done. So that was, 2 hours, an hour and a half a night, once a week. So it really was a great win for me. It was not a problem. I also understood that I knew when I was in my associate's degree program, I was going to get my bachelor's degree. I didn't know when I would do it, but I knew I would go back. So I loaded up on all of my electives. So I only had to take 12 credits. I took 18 credits because I knew I needed to do that. I went to summer school, and all of that was paid for by a Pell Grant. So when I graduated my undergrad in nursing, my associate's degree, I literally had almost no student debt. And then when I went into my bachelor's program, and this is the big kicker of what the big difference is, because I was working as a nurse, I'm not eligible for a lot of grants because now I have this great income, fairly great income coming in. And so my hospital system helped pay for my bachelor's degree.
That is cool. Is that a common incentive, by the way?
That is a common incentive. Yes.
Okay.
Most hospital systems, now they do it, it varies on how they do it. Some are 100% upfront. And if you take a class from us, you guarantee you're going to work 6 months for us. Some of them are less money. Some of them are more money. The hospital I worked with at that time, if you made an A in the class, you got 100% paid for. If you made a B, you got 90. And if you made a C, you got 70. And if you failed it or made a D, you didn't get anything. So you had an incentive to make really good grades, right?
Yeah.
And so that was really wonderful. When I went back to get my master's, the hospital system, I had changed states and organizations. And that hospital system paid a flat $500 per course. Period.
Wow. Okay, so now I'm starting to see a little bit of the advantage.
Yep.
So associate's degree is done via community college.
Usually.
Right? So it's typically cheaper to begin with.
Yep.
Right?
That's right.
Then you get your NCLEX, you go and then you do part-time for as long to satisfy your bachelor's requirements.
Exactly. And it usually, most people are 18 to 24 months to satisfy.
Okay. So, and in terms of the hospital or whatever institution you're providing nursing services at is more likely than not going to cover the rest of your bachelor's.
That's right. Or at least a large portion of it.
I mean, depending on your grades, right?
Exactly.
That
right.
is so cool.
It's really nice. It's nice to come out of school and you have student loans and you have the ability to do a lot of things, but nursing, because there is such a huge need, for instance, the Pell, there's a student loan, I think it's the Pell, but I'm not 100% sure, that if you chose to work in a nonprofit healthcare organization or in rural America, they paid off your student loans for you. So you turn in
For
documents.
how long?
They paid mine off completely.
How long do you have to work to satisfy
what they
that
do
requirement?
is every year you turn in documentation from your HR department that says you are still employed with them, and they paid off the last year's amount.
Oh, so however many years.
Yep, however many years it took.
Fair enough.
Yeah.
Okay. And then a bachelor's of sciences, is there an advantage of going to particular schools? Will it land you in a great hospital?
It can, yes, absolutely.
So before I get there, actually, a typical person will just think that a nurse works at a hospital, but nurses are
all over the place.
Exactly. Can you give me like 10, 15, not 10, 15, as many as you can list off comfortably
Sure.
where nursing nurses can provide services?
In doctor's offices, in schools. When you think of a school nurse, they're usually a bachelor's prepared school nurse. You can work in academia. You can work in insurance industries. You can work in cancer treatment clinics. You can work in nursing homes. You can work in administration. You can work in community. I have a nursing friend who is a senator. It can be anything, anywhere you want it to be. It just depends on how you want to use those degrees.
Fair enough. That's awesome.
It's a lot, yeah.
You can really go in many different places. So associate's degree and then the bachelor's degree, you just finish your degree, write your NCLEX, and...
In a typical 4-year degree, now, and I highly recommend entering in at the bachelor's level because it does prepare you better to be that front line. It's because of that patient care outcomes. It's what the Institute for Healthcare Improvement, it's what all of the medical research and the nursing research, healthcare research in the United States has proven, that if you have your bachelor's degree and you have your associate's degree, your patients actually have better outcomes with that bachelor's degree. Until you hit about 10 years experience, and then it levels out. 8 to 10 years, it starts leveling out. So I think it has a lot to do with the wider variety of what you're exposed to in healthcare.
Let me get some clarity here. So if you do your associate's degree, you still have to do your bachelor's, correct?
You do not.
Okay.
In some states. So that it's state by state is different.
Okay.
So in the Northeast, and I'll use New York and Connecticut are 2 examples, to work in a hospital, at least pre-COVID, things are a little wonky right now after COVID when we're going into a lull of needing more nurses, a really bad shortage. You had to have a bachelor's degree to work in the hospital setting. To South Carolina is like that as well. To work in the hospital, you have to have a bachelor's degree. But that doesn't mean that that's the only place that associate degrees cannot work is in certain areas. Other states don't have those requirements. So you can have an associate's degree working right next door to a bachelor's in the same unit, making the exact same money.
So the distinction was working at a hospital, firstly. So these same exact nurses without their bachelor's could work in all those other job places that you mentioned.
Absolutely.
Okay. So
and a lot of hospital systems right now, this is important to know. If you have an associate's degree, most hospitals and large healthcare organizations are going to require you to go back and get your bachelor's within a certain set number of years. Usually that number tends to be 4, and that allows people to get a year under their belt and then 2 to 3 years to finish school. Most organizations are requiring that, and that's because of Magnet, which is the healthcare accreditation organization that looks at nursing and gives a thumbs up for you're doing everything great to have a phenomenal nursing experience at that organization.
Fair enough. So there's technically 3 routes then. There's the associate's program and then finishing your bachelor's after. Then there's just the associate's program and then there's just the bachelor's program.
Right.
And you said that the best outcomes per research are associates plus bachelor's, correct?
The bachelor's.
Bachelor's by itself?
Whether you have the bachelor's by itself or you have the associates with the bachelor's.
Is there a study
there's not a deviation.
No?
Not that I'm aware of.
Okay.
It'd be a good one to have, but not that I'm aware of. It's having that Bachelor of Science in Nursing that makes the difference, whether you get it one way or the other.
So long as you get bachelor's, you're in good hands.
Yep.
So from an outside perspective, if you have limited resources, it seems like the best route to become a nurse is associate's degree.
Absolutely.
Because it's cheaper to get in. Then most of your loans will get paid off by the hospital.
They will help.
I mean, subject to how well you do at school.
Right.
And given how demanding it is.
Yep.
I mean.
Exactly.
Okay.
Yeah.
And so regardless of whether you go down the associate's path or bachelor's path, you have to pass the NCLEX in America and in Canada.
Yep.
And it said on their website that their pass rates were 72%, with the highest pass rate with bachelor degrees. So it seems like bachelor degrees have a higher pass rate.
That is correct. So if you start with your associate's degree and you take your NCLEX, when you finish your bachelor's, you don't ever have to take the NCLEX again. Okay. So when you finish your bachelor's, and that's the only thing you've done, you take your NCLEX. So it's the same exact entry into the profession exam, But when you have more understanding and more theory, you're probably able to answer some of those questions better than when you have less theory and focusing on that understanding, if that makes sense.
Yeah.
That's what I think the big difference is.
You said that you only have to write the NCLEX once. Under
Unless you
what
fail.
circumstances? Well, of course,
Yeah.
you only have to successfully pass
Right.
once.
Yes.
Are there any circumstances under which you have to write it multiple times?
The only time,
you have to pass it multiple times?
The only time is if you I'm not sure if someone was licensed in the United States, if they had to go to Canada, for instance, and if they would be required to retest in Canada. I don't know the answer to that, but not that I'm aware of.
Okay. So you write this as a lifetime exam. I'm guessing you have continuous nursing education.
Every state has a different regulation on it. The state of Virginia requires 15 hours to 20 hours based on what you're doing.
What period?
Over 1 year.
Over 1 year. That's a lot.
It's a lot. Yeah. Most states are between 15 and 20. And there's a lot of different things that fall under that continuing education requirement. So if I was taking a course, 1 3-credit class at the university covers in nursing covers my continuing education requirement in part. But hospitals do continuing ed all the time for their people, and everything you do is tied to continuing ed. So nurses will all have basic life support or CPR, and we do advanced cardiac life support, ACLS, or the pediatric or the neonatal version. All of those have continuing education, and they're all going to be a hard requirement of many of your positions in the hospital or anywhere else you work. And so you're going to end up getting all of those continuing eds. It's really easy to do. In nursing, it's really easy to do.
That's good. It's not that easy in law.
No,
so,
it's not.
I mean, it's not like it's hard. After COVID, most states just allow you to log on and listen to it.
Yep.
So it's become a lot easier. Before you actually had to attend
Physically
these
attend.
conferences.
And you had to have so many hours in ethics and so many hours in this.
We still have that.
Yeah, right.
But at least we can watch it online for the most
nice.
part. Before, when I was a trial attorney, it was really funny. We had to go and there was these conferences and we actually had to present and we had to prepare for cases and we had to debate. And so it was an ordeal.
Yeah.
And I mean, that's how it was in Canada. I'm not sure how it is here. But all right. So since you're in academia, I would like to know, do you have any tips for students that are studying for the NCLEX and how do you maximize that exam? And I have a one and done thought process. I have my own recipe. And so, studying for these big exams, it sucks if you fail because you have to study a lot again.
Yes.
And
it's demoralizing. It really is discouraging, right?
I don't feel like I don't ever like to look at it like that because with these exams, it could be just as simple as not getting sleep that night.
Oh, absolutely.
But
you still have to take the test again.
Exactly.
Yeah.
Right. So, I mean,
absolutely.
That's one thing I learned. Sleep is one thing that
It's important.
I was maniacal about this. So what happened was in law school for contract law, my favorite class. I'm a contract attorney, by the way. That was one of my lowest marks. And the reason was the night before, I just couldn't sleep. No matter what happened, I just couldn't sleep. And so I woke up in the morning and I literally drank about 3 to 4 coffees and Starbucks double espressos.
Sure.
I was jacked on caffeine and my hand was shivering. And I remember I wrote the first entire answer. And then I realized I missed 1 or 2 crucial words and it changed everything. And I ended up it still wasn't bad. But in law school, a B- matters because they look at your transcript forever. And so luckily I still made life happen. But ever since then, I learned that one of the most important things about exams,
sleep,
and especially these big ones, is sleep. So I had a maniacal routine.
And not just sleep the day before.
Yeah.
It's like a consistency of it, right?
I had for my bar and all of that stuff, 30 days before I went into a militant routine where I didn't speak to, I know chilling out with anybody. I'm living in a bubble. I don't care what's going on. I hope nothing really, really bad happens, but I can't do much. So I'm just going to live in this little bubble. And so anyways, sleep was one thing, but let's get back to tips specific to the exam. What would you tell students about how to succeed on the NCLEX?
Absolutely. So the NCLEX just recently changed. This year, actually, in early 2023, we shifted the NCLEX and the type of testing formatting. NCLEX is very driven to assess your ability to critically think and to make good choices as you're progressing through a clinical scenario. So in that, I think it's really important to practice those study questions. And a lot of schools now require X number. There's 3 large ones. One of them is HESI, one of them is ATI, and nursing students will understand, Kaplan is the third, that will do lots of practice questions. A lot of schools have built that into their curriculum, that you have to pass these high stake tests as you progress through the program. And there's usually a big one at the end of it. The reason that nursing schools have started putting that into the curriculum is because we learned that students who pass have generally taken 5,000 questions or more in their career path. So what I tell students all the time is you know those questions in and out, because it's not that you know the answer to the question, but you can answer the question the way a nurse thinks. Because you're still not a nurse until you pass that exam, but you need to think like a nurse. And the more you begin to look at those questions and understand how they're asking, understand the format of the question, the better you are going to be able to assess the question on the exam. Exams are also written to textbook scenarios. Let's realize that there's never been a single patient in all of known time that was textbook. Ever. So you cannot think into that one patient that you had that had this random similar diagnosis. You have to go with what the textbook says. Test questions. I told students, you put an app on your phone, and every time you hit a red light, you're standing in line at the grocery store, you just take a couple of questions, get thinking about it constantly. I love your idea of getting sleep. That is beyond important. Studies have shown that when you are sleep deprived, you might as well be drunk. And the last person anybody needs to be taking an exam like this is someone who is altered by chemicals, right? And so we tell students, get sleep. Proper nutrition is super important. You don't want to jack up on all that coffee. I love my coffee. I don't go a day without my coffee. But at the same time, it does increase your heart rate, it increases your blood pressure, and it doesn't always allow great critical thinking skills or timely processing. So they do encourage to limit caffeine, hydrate well, and eat appropriate diets. So try to stay away from those heavy sugary diets and eat more healthy protein, plant-based foods. And I won't get into all of that because I don't always abide by that myself in life, but I do think that there is some importance to a healthy diet.
I feel like when you're young, you can get away with all of this.
Can,
that body's robust in the 20s,
Yeah, but right before that big test, do you want to take that chance? Yeah. I don't. I said all of this. I went and stayed the night at my aunt's house the night before I took my exam because I had to travel to take. I was one of the first classes that actually took it on computer. Prior to me, it was a 3 or 4 day test at the state capitol. So I was really glad I didn't have to do that. But you have to learn what's going to be expected of you and what is that process. The more that you can understand the unknowns, the more relaxed you are about that process.
So can you tell me a little bit about the specifics? What type of an exam is it? Is it multiple choice? Do you have to fill in long answers, essays, short?
It's a lot of different things. So it is usually multiple choice. They do have true, false. They have questions that are, if you answer this question, it's going to take you down this path. But if you answer B, it's going to take you down this path. So it's like those books that kids read that, choose answer A and go to page 24, but choose answer B and go to page 62. It's one of those kind of things. So you kind of have it, it's case-based scenarios a little bit more now. Back when I took it, it was very multiple choice. This medication is for what purpose? And you choose your purpose. Now they're going to test that same knowledge, but going to tell you this patient has this disease process. Which medication would you anticipate being ordered? And now why? And now what is the side effect? And now they've had this problem. Could that potentially be from? So the questions are really amazing. And I really do love the new format. I think students are taught how to critically think, and it's less rote memory. So they're not having to memorize a laundry list of a whole bunch of medications. They're able to critically think and choose the medication based on what their critical thinking tells them. But you have to study and you have to be aware of it. You have to understand what the questions are asking to do really well. The other thing I tell students all the time is breathe. Breathe. And I tell students, and I have given bubbles away to students for decades, or at least a decade and a half. I believe that you have to take a breath. And I think blowing bubbles is a great way to do that. And it's a kid's game, and you can almost everybody has a memory of blowing bubbles in the backyard or with friends at a birthday party or a skating rink or wherever. But there's some reasons, because physiologically our bodies change when we take deep breaths.
Have you read the book by James Nestor?
No.
It's called Breath.
Is it really?
And,
Okay, I'll have to read it.
I think it spends 450 pages talking about how to breathe.
I'm telling you, it's amazing. It helps clear your thinking. It lowers your blood pressure, lowers your heart rate, improves oxygenation. I mean, breathing is essential. I always said blow bubbles, and I would find students out in the hallways blowing bubbles before a big exam. And it's because it also it creates happy endorphins. And so all of a sudden you feel better just because you start laughing at yourself blowing bubbles as a 20-year-old, right?
I had a friend, his name was Ali. I have a friend, his name is Ali. And he was just an exceptional exam taker, test taker. And so I asked tips from everybody and anybody. And so I was like, hey, man, what's going on? And he always looked so calm and composed. How do you do so well? How are you so laid back? And he said, when they say you can start the exam, don't start the exam. Take a breath.
Yep.
Once everyone's done scrambling through and flipping their pages, writing their names, and in a hectic fashion, then you start.
So smart.
and he was just like, you will not pass or fail based on the first 4 to 6 seconds of this exam.
That's right.
It's if you studied enough, that should not be indicative.
Yeah.
And so, I took that advice after that, and I realized I was very calm. So breathing was one of those things.
Absolutely.
And so you just calm down and breathe.
Yep.
So you said back when you were writing the NCLEX, it was 4 days. Is it still that long?
Not for me. Thank goodness.
Okay.
We were the first group, one of the first classes that took it online. So now it's up to 2.5 hours. I believe that's the max. One day. Nice. It used to be a 4-day because they would break it in and you had different sections, and now they merge all the questions together. The other piece of it is because it is in testing indicative. I forget the exact term, but basically I can take 75 questions and the computer says, yep, you've got this, you pass. They can take 75 questions. You do not have this and you don't pass. You can take upwards of like 230 questions and have the same outcome. So everybody's going to get a little bit different. Some people may get test questions that are just thrown in to see how students respond to or how graduates respond to the questions. And it's a little bit different for everybody. So nobody's going to get the same questions typically. There's such a huge bank. The bank of questions have been created by nursing educators and nursing clinicians. And because that computer AI basically is telling us where you fall in that line. So if everybody is supposed to be at this line A and all of a sudden or line 0, let's say line 0 is passing and you answer so many questions that has you in the negative, there's no way for you to pull back up to that passing rate. So then the test is over. At the same point of if you're so positive that there's no way you're going to fail this test, they end the test. And so you pass. And so it's such a wide variety. It's hard to say. You cannot base by the number of test questions you received. You can't answer whether or not you passed.
That is unique.
It's crazy. You can have anywhere between, and I know 75 is still the minimum. It might be 65 now. I know they made some adjustments post-COVID, but some people can answer upwards of 230 questions.
So this is all in one sitting, and it's kind of variable?
Yep.
That sucks.
It goes right back to nursing school. It just stinks all the way around.
I mean, that's not nice.
But that's why we say take a moment. And if you need to take a break, you put your pen. I mean, everybody's doing it on a computer, but you have scratch paper and you have a pencil because we do medical math, and they may need to work on a math problem. There's a calculator in the system. I mean, it's all set up there thinking. You can highlight questions. If you say, okay, I think this potassium level is important, you can highlight it on the screen. So it's really great use of technology. And so you just and I would tell students, you just put your hands down in your lap, put your pencil down, hands in your lap, and put your feet on the floor and take a couple of deep breaths. And know that this is not the end of the world. If you have to take 200 questions, you have to take 200 questions. That's okay.
Do not forget to breathe.
Just breathe. Yep. But I'll tell you the truth. When I sat for mine, now this was a long time ago, I answered 76 questions. And I was the first person in my group. There were about 6 of us and from about 3 or 4 different nursing schools who were all testing at the same time. 3 of them were my classmates. And I got up and walked out. And I sat outside for another hour waiting for somebody else to come out to ask them how they felt. And I finally got in my car and left because I was getting more anxious sitting there waiting on them to see how they did. It was just driving me crazy. So I just finally left. I passed, obviously, and one of my classmates did not pass. But you know what? It wasn't the end of her world. And she put her life together. She studied, she focused again, and then she retook the test and she passed. And now she's a great nurse. She's phenomenal. She let testing anxiety overtake her. She said, I hit that 100 question and I shut down. She goes, I was expecting to get the 75 and I can keep going. And so you cannot let that number, that's when we tell students to practice and practice doing a lot of them at the same time. And the more you practice, the more comfortable. It's like, oh yeah, I've answered 300 questions yesterday. 200 is not a problem today. So you want to do that. I also always tell them 24 hours before, put everything down and relax.
Yeah, that's what I do.
Put it down.
Mm-hmm.
Yeah, put it down. Don't answer questions. Don't look at it. Don't think about it. Go out with your girlfriend, boyfriend, have a movie night, go out, have dinner with mom and dad, whatever.
So long as you sleep at the same time.
As long as you go to bed at the right time and you have a good meal. You can't have popcorn for dinner. It won't work.
Yeah. I definitely did that. So that's actually very similar to my bar routine.
Yeah.
And so when I was studying for the bar exam, I studied all the theory. And then in the last 2 weeks, I did an average of 250 questions a day. And they're long. Each question is like a paragraph that you're reading. So same exact thing.
Some people do really good with pictures. If you're a visual learner, there's some great technology. There were books back in my day, but it's moved to apps now and computer-based gaming software that actually is pictures of disease processes. So for example, all I have to think about is hypo and hyperthyroidism, and the picture from nursing school pops into my head. And it's because I saw the visual, I connected the dots. That was not on my NCLEX, but if it had been, I would have had that picture in my mind. So if you're a visual learner, look at some of those projects. Some people do really good by reading. Some people do better by seeing. And so sometimes having that combination of both, I have found works best for everybody.
Fair enough. There was something I feel I forgot. I wanted to know, when you're in the actual, there's hundreds of types of nurses, right?
Yes.
When when you go to a hospital, there's an ICU nurse. You were an ICU nurse. Then there's neonatal. All these other places. When is that decision made, and how do you actually? What if you get stuck in one? Can you get into another one?
Absolutely.
And how do you make all these?
Sure.
So when do you start that decision, and how do you move once you're within?
I thought going into nursing school, I wanted to be an ER nurse. I knew that that's what I was going to do. My aunt was an ER nurse. I loved her stories. I think this is going to be the best thing ever. I hate ER. Now, I love to go down and play in ER. I love to go visit my friends in the ER and maybe work a shift once a month kind of thing. I did that all the time. I found out ER was a lot of what I saw as disorganization. I'm an extremely ordered, organized person. And the ER is just, you don't know if you're going to have a 100-year-old patient or a one-day-old patient. And you don't know if your patient's going to be able to tell you what's going on or if they're going to be unconscious. There's no rhyme or reason to what comes in the emergency department, right? In the ICU, I had the same type of patient. So most of the time, not always, most of the time my patients were cardiac patients. I worked in a cardiac unit. Most of the time, my patients were over the age of 18. Most of the time, my patients came in with this certain list of diagnoses. So I liked having that comfort of knowing what I was getting myself into for the day, if that makes sense. So I'm very organized. In the ER and ICU nurses are always joking with each other. You guys are crazy. You guys are like too stuffy. And you have to know your personality. And I think you learn that in school. My best friend in nursing school, and we worked together as directors. She was service line director for maternal child, loved mother baby, labor and delivery, all of that experience. I had a horrible experience as a student and never wanted to work labor and delivery.
But do you make that decision in university?
You can, but you don't have to.
Okay.
A lot of students leave school and they're like, I think I'm going to just do this for a little while. I think I might like to do that. Most of the time in nursing school, because you are given such a wide variety, nursing school, you're required in the state of Virginia and in most states, 500 hours of clinical experience. So in that 2 and or 4 years of clinical that you're doing and of schooling you're doing, you're also doing 500 hours of clinical. And in that 500 hours, you are experiencing almost every type of nursing there is. You're going into the OR with your patient. You're not doing OR nursing, but you're in the OR with the patient. So you get to feel if whether or not you would like to work in that kind of a setting. You are going to do something with neonatals. You're going to do something with peds. You're going to do adult. You're going to do ICU, ER. You're going to hit the bulk of those areas. And so you get a good feel for what feels good to you.
And the clinicals, is that for an associate's degree right
It's
after?
still 500. No, it's in school.
It's in school.
In school.
Oh, okay.
That's why they're saying that's the hardest degree.
Okay.
Yeah. So you take a class on, let's say you take pediatrics class. In your pediatrics class, you have your however many hours of lecture every week, and you're going to have a set number of clinical hours in that group. The state boards don't typically say you have to have this number of hours, but every school you have to have clinical hours based on that environment and in that subpopulation.
And
so
that's the
you
same
will
thing
do
for
that.
associates and bachelors?
Yes, it's all 500 hours.
So how do you squeeze that? I mean, bachelors make sense. It's 4 years.
Yep.
For an associate's, you have to, I'm
you
guessing.
do it in those clinical hours. Yep.
That's a
in
lot.
In those same clinical courses, you do it all. Yeah, it's a lot. But, you know, it's that opportunity to see, are you going to like nursing?
Yeah.
Are you going to enjoy the day in and day out of being a nurse? Are you going to love the ER and hate the ICU, or vice versa?
That's really neat because not many professions have that. You know, if you get into law, for instance, or even if you become a doctor or accountant, whatever you're exposed to is what you become typically, right? So a lot of people feel pigeonholed because the first area that they practice is where they're stuck, and you have to make sacrifices if you actually want to get out of your field.
Right.
So the fact that nursing exposes you to so many different areas is definitely an advantage not many other careers have.
Let me just give you one example. I should have mentioned this earlier. I had a friend who became an ER nurse. He loved working in the ER. He ended up working with police officers on sexual assault, domestic violence, human trafficking. He ended up becoming an attorney, was a DA, and is now a judge. And he still maintains his RN license.
Oh, wow.
It's pretty impressive. So, I mean, you really have the ability to do anything as a nurse. You may have to go back to school to do something outside of the profession proper, but there are so many opportunities. And he turned something that he enjoyed doing as a nurse into something that he loves doing now as a lawyer and as a judge. And he's using nursing and his legal background to actually improve mental health in Central Virginia.
Wow. Good for this man. Maybe I should have him on the podcast.
Yes, absolutely. I can hook you up.
I'd appreciate that. All right. I feel like we have a good idea about school. It's so awesome that you can become a nurse. So you can get exposed to so many different areas of nursing. I always ask with respect to every single profession, what type of characteristics do you need to become a nurse? Like, is empathy required? And so, I mean, we want to know.
Sure.
Basically, the reason why I ask this question is because some people should not be in particular professions. And it's not because they're bad or not talented. It's just their skill set would not flourish in this field. So what type of characteristics does a nurse require to flourish? And what are the characteristics that should really, really stay away from the nursing profession?
You have to like people. It's what we do as nurses. You have to like people. And I say all people. It doesn't matter. As a nurse, it doesn't matter to me anything other than that's a person in the bed. I don't care about where they're from. I don't care about their financial status. I don't care about anything other than that's a person and I'm going to take care of them. I don't care if they have insurance or don't have insurance. That's not what I'm called to look at. I'm called to take care of them. I think you have to have empathy. I think empathy is very important. In a lot of cases, we say, you know, the patient is my patient. And in some situations, the family becomes your patient as well. And you have to be able to be empathetic, but you have to be able to also put walls up to protect yourself. And there are memes out there all over the place about the nurse that you don't see, and it's usually a female out in the back hallway, and her head's down and tears are streaming. And I can't tell you how many times we've cried in a break room, and we do cry in the hallway, but you have to find a way to put yourself together because you're there for the family. It's not about you. It's not about me as a nurse. I've been with many patients as they've passed away. It is never fun. It is nothing that I certainly don't enjoy it, but it's not me. I'm not going to cry in that room. I may have a tear, but I am not going to cry in that room because this is about the family and this is about the patient. And so you have to learn to put those walls up to protect yourself and to maintain professionalism. I think you also have to be smart and be willing to learn. Nursing is always evolving, whether it is new medications, it's new treatment, it's new plans of care. It's so many new things all the time, new technology. AI is getting involved into healthcare now. We're seeing a whole lot of switch and changing due to technology. You have to love to learn. And so you have to be smart. You have to have a desire to learn. That doesn't mean that a straight C student isn't a phenomenal nurse. I've had lots of students who made straight C's through nursing school, may have even failed a nursing class, and are out there being phenomenal, amazing nurses. But you have to be willing to learn. I think there has to be humility. I think we are not perfect. And I think understanding that we're not perfect is important because that helps us catch before mistakes make it to the patient. It's that double check and triple check before you give that medication. It's that having someone else look over your shoulder to make sure the stuff is accurate when something's not quite right. I think you have to have, I laughed at a student one time, not at the student, but I kind of giggled to myself when they said, oh yeah, I became a nurse because I don't like math. And literally inside I started laughing because I'm like, you don't realize how much math is actually involved in nursing. Now, I'm not saying every role of nursing does a lot of math, but everything for pediatrics is weight-based. So it's always a multiplication problem. Everything in critical care in our IV drips, all of it's weight-based. Well, not all of it, but almost half of it's weight-based. So because of that, you have to be able to do basic math and some more intense math. Luckily, we have technology that backs us up, but you don't want to be the nurse that hits that button and the program was wrong in the computer and you didn't double check it with your own math. Mm-hmm. And so we always double check technology. We double check each other, but it's all because it's all about patient safety. It's trying to make sure that the patient is great. So I think it comes down to a love of learning, humility, loving people, and being willing to engage and meet them where they are. People are very vulnerable, and they're more vulnerable with their nurse than they are with their physician, with their family. They're more vulnerable. We are welcomed into their most vulnerable moment. We do things for them physically that they would never want their spouse or a loved one to do for them, and they let us do that. It's a relationship that's built on trust. It's a relationship that's built on honor and respect. And I think nurses, you have to be able to put yourself into that situation to do a really good job. Now, that doesn't mean that you don't have nurses out there that probably ought not to be nurses. And I told a girlfriend one time, and I said, if I ever get that calloused or if I ever get that uncaring, tell me so I can leave the profession. Because it's time for me to go, because I'm not doing good for the patient and I'm not building that trust. And without trust, there can't be honesty. And without honesty, I can't do my job as a nurse.
Okay. So you gave me a pretty long list of things that you
Yes.
need.
Yes.
Right? Which is honesty, building rapport and trust,
Right.
empathy and compassion, willingness to learn regularly, and a few more. Watch the episode. But in terms of what type of person would hate this job, I don't want to just say the opposite of all of those things,
Right.
but there are certain people that'll probably struggle.
Yeah.
So
yeah.
what are those outside of just being, getting calloused and
Absolutely.
things of that nature? They're
I've worked with nurses who, honestly, I'm not sure why they became a nurse. They don't think through the nursing process. They don't make connections with people. So I think if it's hard for you to connect with people, you might not want to do this. Now, that doesn't mean that there's not a nursing field portion for you. And I'll give this as a great example. I worked with a young man a few years ago, and he had a lot of issues with eye contact. He had a lot of issues with connecting with people. He just really couldn't seem to connect on a social level. And there were some reasons for that, but there was a lot of that. There's empathy was a problem. Socialization was a problem. You know what he's doing now? He works in research. It's perfect. His analytical mind is great with research. It's just what we need. It's who I want, looking at the numbers to make sure that this new medication is going to save lives and not kill people, right? And so he's doing a fantastic job. So I think there's almost area of nursing for everyone. If you don't like children, don't be a pediatric nurse. It's that simple. If you love the idea of caring for people at the moment of life, so labor and delivery, but you're scared to death of walking through death with someone, you might not want to be a hospice nurse. But you know what? There's a lot of amazing hospice nurses out there in palliative care who are so impactful on those families that the families could not have walked through that part of their journey without that nurse. Mm-hmm. So I think there's not any one thing I can say. I would say arrogance is a problem typically, but I find that is a problem in a lot of fields. So, I mean, if people are really arrogant, you just don't trust them. And in nursing, you have to be able to trust, your patients have to trust you, right? And so I think that to me is probably the biggest turnoff from a nursing perspective, but be willing to listen. And if you have a humble heart, that's not a problem. But I can't think of any one character, if you're untrustworthy, but only you know that. Right.
Yeah. Well, I mean, I get what you mean.
Mm-hmm.
I get what you mean. But when somebody thinks about a nurse, they're typically thinking about ER in the hospital and things of that nature. So, or at least those are the fields that they most align with nursing. Mm-hmm. So let's just talk, I guess, with respect to those areas of nursing. Who would struggle in those areas?
If you are so independent, if an individual is independent and is not able to work well with a team, you're going to need to avoid those areas. Absolutely, 100%. Nursing is a team sport. And when I say team, it's teams of nurses, it's teams of interprofessionals. We work together as a group of people. I've worked with individuals who had a hard time being a part of the team. And when that happens, they usually don't stick around very long because nobody wants to be on their team either. And that's really kind of sad. I've seen new grads come out and they want everybody to help them, but they're not willing to help everybody else. Mm-hmm. And nurses will pretty much, they'll pick them pretty quick. And then they're like, oh no, I'm busy, I can't help because you didn't help me and you didn't help my patients. So now that doesn't mean when the patient calls out, we're all going to help because we take care of the patient first and foremost. But there ends up being that distance in the team, which is never good for patients. It's never good for the organization. It's not good for the group. So I think people who struggle with teamwork and trusting other people, that might be a big challenge for them.
Okay. So I think we have a good idea of who would flourish and who would have a tough time in the field. Now, like you said, there's many different areas of nursing. Mm-hmm. But I want to talk about where you've practiced in ER specifically. Mm-hmm. What does an average normal day look like for a nurse? What do they do? What are some of the more smaller tasks that someone that's getting into this profession should expect to do on a daily?
We do a lot of charting. And I hate to say that, but that seems to be what a lot of registered nurses, part of our role is making sure that everything is documented. There's the statement that if it's not documented, it didn't happen. And so from a legal perspective, you have to protect yourself in the organization. So we spend a lot of time charting. That's also the communication from nurse to physician, nurse to physical therapy. It's that communication is done all within that medical record. And now it's electronic medical records. And so because of that, we do spend a lot of time charting.
And thank God for that.
You've got to do. Oh yeah.
Reading that writing, I used to be in when I did personal injury, I had to look at medical records. I was like, Jesus Christ, who writes like this?
Yeah, no, I understand. And we used to, and when I was at the bedside and we did only paper charting, every shift had a different color. So if you did flip shift, you had to remember which color pen do I bring to work. It's crazy. So medical records, electronic makes it so much better. Really does. So we do a lot of that. We do a lot of patient care, obviously. A lot of people think nursing is really task-oriented. You give the medications, you give the bath, you do, you start an IV, you change out medications, you put a Foley in. And we do all of those things, but we turn it into something that's more than what people realize. So I'll give you the example of giving a bed bath. And some nurses would say, well, we don't give bed baths. We have aides who do that. And I think that's very poor nursing. And the reason is because in that moment of bathing someone, it's an extremely intimate, vulnerable position, and they are utterly honest and open with you. You also have the opportunity to do a skin assessment. The skin is the largest organ of the body. And so when you're bathing someone, you're able to see nutritional status, hydration status, look for bed sores and rashes and skin breakdown that all lead to infection. And it's literally a 15-minute activity once you get good at it. but it is what makes the patient more comfortable, but it also is a huge assessment piece of it. And so nurses do things that people don't realize what we're doing, and sometimes we don't even realize what we're doing when we're doing it. So bathing is happens to be really one of those great opportunities that we build rapport with our client. We are able to support and help them. Other things that we do a lot of communication from patient need perspective with various pieces of the hospital. I think of nurses as the hub of a wheel. So if you think of an old time wagon wheel, you have the hub, and when that hub is broken, the wheel will not stay. And you need every piece of that wheel. You need the spoke that leads to occupational therapy, and the spoke that leads to respiratory therapy, and the spoke that leads to this, that, and the other. But that nurse is the hub who communicates and makes sure the communication reaches to the right person all the time. And many times, because the patients don't trust anyone else, they say things to you as a nurse that you have to hear, and you have to acknowledge and be present in that moment to catch that one word that might lead to an entire different treatment plan or a complete different diagnosis. Nurses do not diagnose medical illnesses. We have nursing diagnoses, and we diagnose the human response to that medical diagnosis, if that makes any sense whatsoever.
No.
I think I just put him to sleep.
The human response to medical diagnoses.
So, for instance, a person is diagnosed with congestive heart failure. In congestive heart failure, typically patients are on a laundry list of medications that have a whole list of side effects. They are also usually on a fluid restriction at some point. As it worsens, they end up maybe only able to have 32 ounces of fluid a day, sometimes less than that. And if their life evolves around food and having fun with family, and every time you have a big meal, you have a glass of wine, you have 3 bottles of water, you have all these, they become depressed. And so that depression, while it is a diagnosis, it's also a mental response to the medical diagnosis, if that makes sense. So nurses are trained to cue in on those elements that point to that diagnosis and then be able to intervene. So sometimes intervention through conversation, intervention through we give medication, we don't prescribe medications, we administer. But sometimes it's that we being the registered nurse, when you get to the nurse practitioner role, it's totally different concept, and they do actually prescribe meds. So the registered nurse is the one who looks at the whole patient, holistically everything, and tries to put a picture together for the rest of the medical team, the rest of the healthcare team.
Okay, you brought it up. So this was a later question.
Yeah.
What's the difference between a registered nurse and nurse practitioner?
Absolutely. A registered nurse is the entry level into what we would call professional nursing. You have the licensed practical nurse, so the LPN role, or LVN, licensed vocational nurse in some states. They are typically report to the registered nurse and are overseen by registered nurses. They do a lot of similar things, but they cannot do everything that a registered nurse does, and they are under the oversight of a registered nurse. Then you have the professional nurse, which is the registered nurse, which is what we've been talking about. The nurse practitioner is above and beyond the RN. So they have to be an RN, and then they go back for additional education, usually at the master's level, moving more and more towards the doctoral level. And so they have a doctor of nursing practice, and they are either oriented on a specific population, like a pediatric nurse practitioner, neonatal, psych mental health nurse practitioner, adult nurse practitioner, or a family nurse practitioner. So family being from birth to death and everything in between. A nurse practitioner is not, we look at medical diagnoses from a nursing perspective. And I know that sounds very confusing, and there's a lot of even confusion in the healthcare world. They're not a doctor, but they do a lot of things that a doctor does. So they still do medical diagnoses. They are able to prescribe medications based on the state. And the state regs are very different at the nurse practitioner level, and each level of nurse practitioner role is a little bit different than the others. So a family nurse practitioner, for example, might have taking care of a 45-year-old who has history of diabetes and who is helping them manage and maintain their diabetic status and making sure that their blood glucose, everything is stable. If that person has a heart attack, they're going to go to a physician to be treated for the heart attack, and then they usually will come back to that nurse practitioner for that monitoring and continued care. The nurse practitioner is a great role, especially we really see it very heavily used in a lot of rural areas where we don't have enough physician coverage. Nurse practitioners are able to get out there and help network to get a patient to the right type of physician. I actually see a nurse practitioner because I trust her and I think Sarah's amazing and she takes great care of me. If I were to have some major health problem, I would probably go to a physician with that specialty. But as someone who sees me as a whole person and is able to take care of me as a healthy person, she's fantastic. I have a dear friend who's an FNP who works with cardiac patients. She works with patients who have a congestive heart failure. So she helps them through that diagnosis process and helping them to maintain in their heart failure and to improve based on diet and medications and education.
Okay.
It's another test. It's another 2 to 3 years of education and another massive exam to get certified and then licensure.
All right. So how many years of RN experience is there a prerequisite, or can you just go straight from RN to
It
nurse
depends on
practitioner?
the school.
Okay.
Most schools have at least a 1 year of practicing as a registered nurse to go to NP school. Most of them will say, okay, you have to have 2 years, but you can come in and start taking basic level classes during your second year. A lot of schools are doing that now. There is no hard and heavy requirement by federal regulations or by state regs or by accrediting bodies or anything like that. They do have advanced courses, and we call them the 3 Ps. So it's physical assessment, pharmacology, and pathophysiology. So they take these advanced classes to go deeper into those illnesses and treatments of those illnesses, in addition to multiple more clinical courses where they're practicing at that level and learning at the level of the nurse practitioner.
Okay. So you said they can get a master's, but it's going towards
A doctorate.
But can you do a doctorate without a master's, or do you have to do both?
Usually they do both at the same time.
God, that's
So
a lot of
it
education.
ends up being 3 years. Usually it's 2 years for the for the nurse practitioner portion, and then 1 year of research and writing and theory basing and all of those kind of things at that leadership at that higher level as a doctorally prepared nurse.
And is it similar to RN that hospitals will pay for these things, or is
Many
that?
times they will.
Oh,
Mhm.
okay.
Yeah.
All right. So you are incentivized, but are
And
you working during this
there
time
you
typically?
you can.
And what's the norm?
Most of them definitely work during year 1, usually don't work during year 2 because of all of the clinical requirement hours, and then we'll work again in year 3 typically.
Okay. All right. Well, thank you very much. Now we know about how to become a nurse practitioner as well. And that seems like a lot of studying.
It is.
We will be
Yeah.
talking about income in a little bit.
Yep.
So at that point, I would love to know the difference between what an RN
Absolutely.
and an NP. Okay. Whew. That's a lot of information.
Nursing's pretty intense
It's making
and
me
complex.
this interview is making me realize I should ask people from academia and
Clinical.
they would be the best interviewees because you know so much about that portion as well. I don't think
Yeah.
I've gotten this much thorough information about how to become something.
It's difficult, but I don't want to say it's cookie cutter, but in all honesty, it's the same.
Mm.
Everywhere you go, it's the same. It's the same. You have the same amount of hours that you have to get. You have the same similar experiences. So the process is very structured. It's structured. It's complex, but it's very structured.
Okay, so now we have to move on. We know a lot about how to become, what the nurse actually does. I'm pretty confident the job of a nurse is stressful. But as you get used to it, obviously the stress response should decline. What aggravates a nurse's stress on a day to day? What makes your life a bit easier? And what kind of advice would you give to young nurses on
Yeah.
how to handle such a stressful environment? Because so I used to volunteer at a hospital. And you were talking about that situation where people died and you have to create boundaries and things of that nature. So I remember, and this is when I realized this field is not for me.
Yeah.
There was a 37-year-old patient that was admitted, had a cardiac arrest, code blue. I remember that. You know, in Canada, the healthcare system, it's free. So I don't know how it works here with respect to all the codes and stuff, but they called it code blue. All
Code blue
available
too.
resources came and they ran towards this one person trying to just keep him alive. I literally remember doctors, nurses. The nurse jumped on top first. Yep. They were doing anything and everything possible. Then they brought a whole bunch of stuff. They failed. And the morale, and
it's heartbreaking at times.
Yeah. I believe the guy was 35 or 36, really, really young.
Yeah.
The two kids were sitting right there. It was a sad, sad time.
Yes.
Everyone was down for the rest of the day. And I was like, I can't handle this. So I was like, okay, let's go somewhere else. Yeah. But anywho, so back to stress level, what aggravates it? How do you manage such a stressful environment on a day-to-day? And how do you create those boundaries?
Sure.
What advice would you give?
Stressful. Death is stressful. It doesn't matter. Even if you have been doing nursing for as long as I have, I hear code blue and my heart just goes, ugh. Even today, I was in the hospital recently with a family member. She was a patient and I was just there visiting, and I hear a code blue, and it's all I can do not to jump and run. And it's because it's ingrained in us to save lives. That's really what our whole goal is to save lives and to make life better. That's what healthcare really is supposed to do. We're not always great at it, but we really do try. And I think so for me, dealing with death became a fairly frequent situation. Now, again, I'm an adult ICU, so most of my patients were older. I have had cardiac patients who were as young as 18. When I've worked ER, I've coded patients as young as 3. And this is one of the reasons why I chose not to stay in the ER, because that was very hard on me. I didn't have children at the time. I was still a very young nurse, but it wasn't, I knew if I stayed in that and I constantly dealt with death of children, I didn't think that it would be good for me. Of course, I have friends who that's what they do, and they're cancer nurses for pediatric cancer patients, and they do phenomenal and they love it and they can't imagine doing anything else. So you have to find what is important to you and what you're able to handle. It's not, I don't ever want to say it's a good experience, but sometimes death is okay. And death is still an experience. And let me explain this. I was in a patient's room one time. He knew he was dying. He had already made the decision. He didn't want us to code. We weren't going to do anything. His family was in the room with him. He was laughing and joking and having a family moment and loving on his family. Now, he was an older gentleman. His daughter sat down and out on the bed. I'll never forget this. He said, "Dad, will you meet me at the pearly gates when I die?" And she, at the time, was older than I am now, so she was probably in her 50s. And he opened one eye and he said, "I don't know. I've never died before." And, the whole room just burst into laughter. I'm standing at the door, and I have cared for this man for weeks. So that he and his family had become a part of my life. And so, because you are so ingrained in caring and you are in those vulnerable moments, you learn a lot about people. And I remember walking out of that. He died about 2 hours later, and we provided postmortem care, which we always do with utmost respect for the person and for their family. And I remember telling the student that was working with me, I said, "This is a good death." And she was like, "Oh, that's a horrible thing to say." And I was like, "No, but really, he was comfortable. He wasn't in discomfort and pain. He was ready. He had made peace. He was surrounded by the people who loved him. This was a good death." Mm-hmm. And so I think you have to find those moments of positive, even in the moments of death. And it's weird to say that. And I don't know that not everybody has those kind of experiences, but I've learned that is to deal with death on a day in and day out basis. And this was a huge problem during COVID. Nurses were experiencing death so frequently. It was an emotional overload, truly, and mental overload. And so finding that moment where this was a good death, his family was okay. Yes, they were sad, but they were good. They were in a good place. So I think that was important for me as a fairly new nurse, was experiencing that moment. I think the other pieces of stress are the interruptions of the day. And this is going to sound really funny, but we are so ingrained in making sure that everything happens without a problem. So let's talk medications. Sometimes you're giving someone 15 medications at one time, and you have to know which medication goes with what, which one you shouldn't give with this, what are the potential side effects and risk factors? Did you get the right size? Did you break it in half, or did you give them 2 like you were supposed to? There's so many different questions. And that's always when somebody stops and asks a question. So as a family member, you don't want to ask a question when they're going through the meds. Just don't ask the question. Wait until they breathe, because that's the moment they're going to go, hold on one moment, because they're in their train of thought and they're doing it to protect the patient. And so don't interrupt them when they're trying to do medications. Just that is like a huge problem. Nurses would tell me, even if they would just stop for 5 minutes and let me give my meds, then I'd sit down for 20 and talk to them. But I just can't do that. I think that's part of it. I think those are some of the big things. I think teamwork is how we get through it. So nurses are a breed of our own. We bond together. And because we are so team focused and we are so vulnerable with each other in those high emotional status moments, we have that ability to pick each other up. And so when you see someone who is having a really rough day, I worked with a nurse one time and she had 2 deaths on the same shift. And back pre-COVID, that was a very unusual experience. And so telling her, you know what, you go take your lunch. I can take care of this patient. You go take care of you. So I think we watch out for each other. And that's part of that team. And so learning to trust your team and asking for help is really important for new grads, especially because you're still learning the role of nursing and you haven't had that ability to step back and pull yourself out of the situation. To build those healthy walls, that's what you have to do, is sit there and say, this isn't me. This isn't my loved one. Yes, I adored this patient. She's precious. She is not my grandmother. She is not my mother. And you have to remind yourself of that consistently. And I think that that's how we build those walls. I think we also use humor. And nurses find the most ridiculous things funny. And it is just hysterical sometimes, whether it is a nurse. We were coding a patient and her keys in her pocket touched the metal bed and she landed on the floor. It zapped her. And, of course, we're all going, okay, that was really stupid. You know better. You've been a nurse for like 30 years. Why were you that close to the bed? But of course, we also had that moment of pure panic. Is she okay? Did she hit anything? Is she down? Do we need to call a code on her? There's all of those other things. So, she ended up being fine. And we pulled her up. And of course, for days, she was like, hey, shot queen. We had the most fun. She would get pictures of electrical bolts taped on her door. She was a manager. It was, you have fun with you. So you use that humor to kind of help you pull through those situations that are challenging.
Okay, so positive environment.
Yes.
Definitely need
Always
that.
look for the workplace environment. That's more important than anything else.
Do they have reviews out there where we can actually figure
They do, absolutely. Most hospitals have a review and you want to look for it. And nurses are pretty quick to speak the truth. Okay. And so that's important. So as a nurse, when you want to go out, always, as a new grad, when you go for an interview, ask for a tour of the unit and then ask if you can speak to a nurse.
Good advice.
Ask if you can speak to them and just say, I'm just curious, what do you feel about the culture of this unit? How do you guys operate on teamwork? What do you feel about night shift? How do you, and learning those little culture elements in the unit will really help a long way to make sure it's a good fit for you.
Fair enough. Well, that resolves the stress question. Mm-hmm. I don't think this is that relevant, but I'll ask it anyways. Does the job get redundant?
I never found that it did. But again, you saw my career path. I've done a whole lot of different things. And anytime I felt like I needed a moment to learn, I would go try something new. And
so you talk to a lot of nurses and you mentor. Mm-hmm. Is that something that you find other nurses say?
Yes. Yeah.
They find it redundant?
No. No, because every patient is so different. So I worked with a nurse who had been in the exact same unit for 50 years before she retired. Same unit, same hospital, same organization, same everything. She was one of the best nurses I've ever worked with. She could see a patient walk into the unit and she knew their diagnosis. And she's like, I don't know how I know, but he has this wrong with him. And she was right all the time. She was brilliant. She loved what she did. She would never have said her job got redundant. You never know when you're in the emergency room. You never know what's rolling in that door. Even in an ICU or a med-surg floor, you have the same tasks every day. So we give medications at 9 a.m. We have patients up for lunch at 12. We give medications again at 2. We make sure everybody's trying to take a nap at 3. We have these certain rules of the unit and the patient population, but it's different every day. And I think that's what keeps it interesting.
That's cool. Well, you mentioned COVID earlier, and COVID was a tough time for nurses, doctors, everyone in that
healthcare.
Whoever was involved in saving lives, I'm
Yeah.
sure it expanded even outside of that, right?
Mm-hmm.
So
I think everybody in the world had a problem during COVID.
yeah,
Yeah.
yeah. But I mean, nurses, doctors, and the people at CDC,
Mm-hmm.
I'm guessing a lot more than us, than regular citizens, right? How did COVID impact nurses, and what changes remained in the field? Like,
Sure.
how, like, I'm sure there were some positives that came from it as
Oh,
well.
oh my
And they,
goodness.
like, some
Yeah.
efficiencies or something, that we
Sure.
learned during COVID. So,
Yeah.
can you talk to me about how COVID impacted the profession and what sticks with it?
I think the biggest thing was nobody knew what to do. We didn't know where to start. We didn't know what was the best treatment plan. We didn't know, should we, just wear a mask? Do I need to wear a mask and eyeglasses? Or goggles? Do I need to suit up? We just didn't know what the treatment was. And that's very frustrating for nurses because we are ingrained, this is anybody in healthcare, it's not just nurses. Your goal is to help people, but we didn't know how to help. And that was very overwhelming. And as we started learning what was working, then it was, okay, now we know what to do. But these things were difficult. Patients on a ventilator who we had to rotate and prone. So you would have people who were on their back, and then we would roll them on their side, and then we would roll them on their stomach, and then we would roll them on their other side and start the process again. And because we were doing that, it was the right treatment. It was good, but it's very physically taxing as well. Not to mention, because we were in goggles and masks and hoods and gowns, it was exhausting physically. We were hot and just burnt. I mean, it was just exhausting. I don't know how else to explain it than what had normally been an 8-hour piece of cake shift became a 16-hour gruel in that 8 hours. It was just like, this is overwhelming everything. It overwhelmed every service. You had patients coming in who we didn't know what the diagnosis was going to end up being. Is it COVID? Is it not? Do we gown everybody? Do we glove everybody? Do we do everything? How do we do this? And I think that was the biggest challenge. And we'll say nursing does have a fairly high suicide rate across the board, higher than the general population. And that's kind of scary to start with when you look especially at critical care and ER nurses have a higher suicide rate, and it worsened during COVID. I think it had a lot to do with the frequency of death that we were experiencing as nurses across the nation. And this is true about a lot of healthcare providers. You see have seen an increase in suicide. That increase, I think, is due to a lot of reasons, but I think a lot of it had to do with that feeling helpless and hopeless, losing patients left and right, utter exhaustion. You're talking about sleep being important before you take a test. Sleep is important before you go take care of a patient. And so I think it was just a cluster mess. It was just so much all at one time. And the unknown is fearful. I knew a nurse who actually didn't hug her children for over a year because she worked and lived in their basement. And she wouldn't go upstairs and she wouldn't go near her children because she was so scared of her children getting sick. And so there was isolation for nurses as well that was different than other people because, yes, you were isolated, but generally you had your core people around you as a nurse because you don't want to carry anything. And now, 20 years ago, I would take my shoes off and leave them in my car. I never carried my shoes in through the house because whatever was on the floor of the hospital did not need to be in my house. And so they stayed in the trunk of my car or on the porch. And so there were things like that we've always done as nurses. But when COVID hit, because it was so fearful and so unknown and death rates were so high, we now became fearful for our kids and our husbands and our wives and our families in general.
Wow.
And so this specific nurse, she literally lived in her basement for a year.
Wow. I mean,
that's heartbreaking. It's sad. It's she had a tough time.
Did nurses get a bonus or something after COVID?
We always laugh and say sometimes we get trauma pay. and so trauma pay is, sometimes it's maybe working with a whole bunch of new graduates, you might get trauma pay. So it could be anything as little as that to full-blown picking up shifts. Nurses at one point were making over $100 an hour taking care of patients on certain units during certain times of the day. Yeah.
Okay. Well, when I asked you about COVID, I was actually, I'm very glad that you gave me the backstory. That's really sad and how it impacted. I was wondering if COVID impacted the profession in a way which we now still have those changes in the day-to-day. Like, I'll give you an example. In all other fields, everyone got comfortable with working from home,
Mm-hmm.
and we started just Zoom calling
Yeah.
everybody. And so, what was the impact from COVID that stayed with nursing?
Sure. Nursing education changed. We began using virtual simulation at a whole new level. It was amazing to watch. Technology caught up to what we needed it to do really quickly, which was kind of funny. We can't do that. No, we can't. Oh, look, we can do it. And we did it really well. So I think our mindset changed a lot from an education standpoint. In practice, we now have new guidelines and new ways of managing high stress situations for nurses. We are more engaged in self-care than we've ever been before. I know we were talking about, making sure you get your sleep, making sure you eat well a decade ago, but we really hit that very hard during COVID. And so I see hospital systems are more engaged in the mental health and wellness of their nursing staff and their staff in general, but their nursing staff more now than they ever have been. Nurses, a lot of them left the profession, and that's going to impact us over the next years. We've seen an increase in retirements. We've seen an increase of people who worked full-time go part-time. Everybody came back for COVID, and then it's like, shoo, we've left. And part of that was people were tired, or people were afraid and left during COVID, and that happened as well. So that's part of the shortage that we're experiencing now and will for the next probably 5 to 10 years. Yeah. So that's impacting it. I'd say we're faster to move research into practice, which is really good. Sometimes you see really great research coming out. When I was in school, it took 17 years from research in the clinical area to actually impact in the actual clinical hospital setting. Now it's maybe a year, if even that much. We're moving at a much faster rate to conduct research and then to make good research practice. And that's pretty impressive. It's exciting.
That's
if you're
cool.
a nerd like me and you like research.
I have a doctor friend, and he is really into research, and he definitely takes continuous, I guess, medical education
Oh,
very
yeah.
seriously. He's always reading articles. He's very up
Yep.
to date.
Mhm.
So he fills me in, and we're always fighting. But now we're getting to that point where I want to discuss how much money does a
Mhm.
registered nurse earn when they start,
Yeah.
and as they progress, how much do they earn? And since we discussed the nurse practitioner as well, I would love to know what they can expect, and what is the actual influence
Yeah.
of degrees on income. So
Absolutely.
let's just start off with registered nurse,
All right.
and we'll move forward.
So typically a registered nurse is going to start making about $24 to $25 an hour. Now, that is different when you are working night shift, when you work weekends, when you do weekend only. So you have most hospitals have a bonus structure of some sort or a tack on pay. When I got out of school, nurses were making like $10 an hour. So we've made it a long way now that we're up to there. I will say in bigger cities, nurses will make more. In more rural areas, they'll make closer to that 24 mark. There are some that will make closer to the 45 mark coming out of school, working night shift on the weekend in an inner city hospital, for example. So there is ways to definitely impact that bottom line dollar if you're willing to do it. I worked night shift for the first year out of nursing school. It was absolutely fabulous. I loved it. I made bank. I paid off student loans. We got married. We had money to blow. And so it was what we needed at that time, and it worked really well. So I think for a lot of nurses go into night shift because there is generally a $4 to $6 an hour difference just to work night shift. So that's pretty important. A lot of nurses are traveling, and that has changed. With COVID, nurses began to travel. We've had travelers for over 20 years, but for nurses would travel to big cities as COVID progressed across the United States. Nurses would travel where that progression was going, and we saw that migration trend. And as travel nurses, they make more money as well. There are nurses, bedside nurses, making between $80,000 and $100,000 as a frontline registered nurse. The difference between an associate's degree and a bachelor's degree in most facilities is nothing. There's not a difference. There are a handful of facilities that pay a couple of dollars more for the bachelor's degree than they do for the associate's degree. Not many, though. I can only think of a handful of health systems that still pay that. The more a nurse is in the profession, the more money they're going to make. It also opens up that opportunity to work in higher acuity areas. So typically, when I got out of school, nurses never started in the ER or in the ICUs. You had to go work on the floor. We are now bringing new grads into those higher acuity areas because we need them, and we need their insight and their experience and their passion for nursing in these areas just as much as anywhere else. So we're pulling them in, and so a lot of times at higher acuity areas the nurse makes more money. So there were some hospitals that had COVID units, and if you worked the COVID unit, you made a significant more money every hour. So $100 an hour is nothing in a COVID unit.
And so everything that we're talking is pegged to hours.
Yep.
So how many hours on average does a nurse work on a weekly basis?
So most hospitals are still on 12-hour shifts. So most nurses work 36 hours a week.
Okay.
There is some that do like 48 one week and 36 the next week. So they work, it varies. And there's always open shifts, so you can always pick up more as long as you're well rested and well nourished and you have the time. You know, we no longer offer, I say no longer, I don't want to say never is it going to be offered, but we used to do 7 on, 7 off. So you'd work 7 days straight and then you'd take 7 days off. That's not healthy for the nurse. It's not mentally healthy for anybody to do something like that. And so they have shifted that, and most are doing 2 or 3 days a week now, 12 hours shifts. Some hospitals like 8-hour shifts, and there's a lot of more flexibility now, I think, which is really great. I think that that's what these younger generations are bringing to the table is, you know, I don't want to work 12s all the time. I want to work 1 8 and 2 12s. Okay, we'll make it work. So there are nurses who work only weekends, and they may work 24 hours over a weekend. So like 12 hours on Saturday, 12 hours on Sunday, but get paid for 32 and get full-time benefits as a part-time employee. So there's a lot of back and forth options and opportunities for the registered nurse to be very flexible. And nursing management is learning flexibility is where it's at. And so I think flexible staffing has become a huge thing in nursing right now in the RN level.
Okay, so would you say $24 an hour is the average, or?
It's pretty much the average for most of Virginia.
Okay.
Now, I could tell you go to California, New York is going to be significantly higher than that. I would say probably closer to that 30, 34 an hour mark. You go down into some more rural areas and you might get closer to that $20 mark.
Okay, and let's say 5 years. And let's just start at the 24 benchmark. So we get like a proportionate increase. What does 5 years and 10 years look like?
If you stay in the same role, you can typically see a 3 to 4% increase every year. You do really well on your annual evaluations, and you're going to get closer to that 4 or 5% increase. If you do okay, you might make only 2 to 3% more. So it's all based on performance. And a lot of that ties back to patient outcomes and patient satisfaction and your team evaluation. So typically it's not just I evaluate me and my manager evaluates me. It's usually I evaluate myself, my manager evaluates me, and maybe one of my peers evaluates me, unknown, and I don't know who evaluated me. And then we look at all the other metrics and data that look at it too. Each hospital sets it up a little bit different. I would say that at about 5 years, if 24 is the starting point, I would say you could be right around 30 to 32, pretty easy. When I had been a nurse in management a while back, I went into that role in the mid 2004-ish range, I was making closer to 45, and I'd only been a nurse for 8 years. And so it really depends on you. It depends on the role that you're willing to do. The higher you go up in management, obviously, the more money you're going to make. And most of those higher leadership roles require a graduate degree. So that graduate degree is not necessarily what gets you the raise as much as what gets you the position that gets you the raise. Does that make sense?
Yes. Now, how much do nurse practitioners make coming right out of, let's say, a master's, and then let's see, does a doctorate actually affect their income?
It can. Yeah,
Okay.
it certainly can. Nurse practitioners, It depends on the type of nurse practitioner, and it depends on where they're working. A family nurse practitioner in the state of Virginia generally is going to come out making $110,000 to $120,000 a year out of school. Now, they've been a nurse for at least 3 years because they had to be a nurse before they went to nurse practitioner school, right? So there is that little jump there. Psychiatric mental health nurse practitioner is a huge need right now, and they're making between $150,000 and $180,000.
Right after getting their degree. That's pretty amazing.
Yeah, it's impressive, right? If you look at the CRNA, which is the nurse anesthetist, it's a graduate and or a doctoral degree. Some schools are moving towards a doctoral requirement to graduate. Some are just still at the graduate level. They're making, $125,000 to $180,000 easy within a couple of years.
Is there any resource available where people can find out this information?
Actually, the state boards of nursing do a lot of research into nursing, and I highly recommend looking at state boards of nursing. Every state also has a nursing organization. So, for instance, I am the I'm the commissioner for nursing education for the state of Virginia through the Virginia Nurses Association. The VNA has a ton of wealth of research through the American Nurses Association and the Board of Nursing, and so they help publish a lot, and they have a lot of links that lead you to a lot of these information. There are also a lot of the job sites that you go to will tell you early and upfront how much a nurse at that facility is going to make. There are websites that do salary counts and can help get you a difference. If I was moving from Virginia to Texas, I could easily find out what is an average salary for a nurse in Texas.
Fair enough. Okay, so it seems like the demand for nurse practitioners has increased,
Yes.
thereby they're getting paid more.
Mm-hmm.
You said there's a shortage for nurses.
Mm-hmm.
So has the salary, has it been
It
influenced in any
is.
way? Is it increasing?
Yeah, it
So
is
can we
increasing.
expect nurses that are starting off now to be earning more than $24 by the time they actually graduate?
Oh my goodness, yes, absolutely. Because of the shortage, you're seeing a lot of facilities also offering sign-on bonuses. There was one hospital whose name I won't give offered a $30,000 sign-on bonus for an agreement to work for 3 years. So their $24 an hour job got a $10,000 a year bonus because they agreed to work there. So a lot of hospitals are doing sign-on bonuses. They do the educational reimbursement plans. They do a whole lot of schools. You get out of school and you have $100,000 in student loan debt. If you go to a private school, that it could be that much for a nursing program. A lot of times those hospitals, for every year that you work there, they will pay off your student loan completely for you, because they realize they have to make it look like a great place to work, because every hospital has a need right now. Hospitals are recruiting everywhere they can go to recruit. You may have hospitals from South Carolina recruiting students out of Virginia. You're going to have, it's everybody needs nurses right now. And so trying to find them is kind of hard. So it is growing. We are going to have a nursing shortage. I believe the last time I read, we were looking at between a 0.5 and a 1.5 million shortage between 2025 and 20. So it's going to be a pretty significant. The last number I saw internationally was 29 million short. Dr. Peter Burhouse does a lot of statistical analysis of nursing, and he has looked at nursing workforce for decades, and his numbers tend to be pretty spot on. And he is saying it's better than we thought it was going to be at one point, and then it's worse because of COVID. So we were trending where we were like, okay, this is going to be, we're going to have a shortage. It's not going to be that bad. And COVID hit, and the numbers completely changed.
Wow.
So I do anticipate that we are. That's why it's a 0.5 to 1.5. We're not really sure what it's going to end up being like. But you have to think we have probably around 4 million nurses in the United States. There are over 200,000 nurses in the state of Virginia. So when you think about those large numbers of needs, they're across everywhere. Rural areas have a huge need. Those hospitals are going to have to start paying what inner city hospitals make to recruit nurses into those areas. So I anticipate that salary going up pretty significant over the next several years.
So this is a good profession to enter right now.
There will always be a need for a nurse. Everywhere, anywhere you go, there is always a job for a nurse.
Yes, that's good to know. Do you think AI is going to have an adverse impact on nursing?
Only if we allow it to. So I think AI can actually help nursing in so many ways, whether it is alerting us with minor changes in a patient status because we can't be in the room 24/7. Typically, even in an ICU, you have 2 patients. Sometimes you have a one-on-one, but that's not the normal. In some ICUs it is, but not the normal across the board. But if we can be alerted faster that something minute is changing, we can actually improve patient care because of AI. I think AI is going to help us with charting. I'm hoping we get into predictive texting. Wouldn't that just make life so much better? Of course, typos in medical records never look great for attorneys, and we never want to have that. But, helping to make sure that we are using the right language to nursing. We get so busy talking medicalese to each other, and then we talk normal people conversation with our patients that sometimes we put the normal in the medical record and people kind of giggle. I wouldn't normally have said that to a medical professional. I would have said that to my patient, to help them understand what I was saying. So I think AI can really help us. You can't do away with nursing. There is nothing that we have right now that will do away with nursing. There are robots who do portions of patient care in maybe China. They deliver nutrition, for example. They have a robot that delivers nutrition to the patient's room. Nurses typically deliver that, or a nurse's aide would do that, but you still have to have the nurse to see the whole picture and to actually do the care. So the only thing I can see is it's helpful if we allow it to be so.
So pay's on the rise. It's not AI susceptible.
I hope not.
This is a good profession to go into, because I was looking into professions, like for instance, they're saying consultants, lawyers, accountants, we're about to take a big hit. And it makes sense. I've thought about it many times. Not like our job is completely computerized, but computers can definitely lessen the amount of lawyers required to get the same exact output. Right? So you're going to need more supervisory and senior lawyers rather than, so that's why I was wondering with respect to the nursing profession is the same thing. Okay, now on to some more positive things. So now you got to sell it to the kids.
Absolutely.
What are the special perks of being a nurse? I know one, which is you guys get 4 days off.
That's right.
And
That's
now you're on flex staffing. So
flexible staffing is great. I think for me, I am a passionate person about nursing, and I think it's because it has met every need in my life. When it was just my husband and I graduated 6 months after we got married. Never recommend getting married in nursing school, but a lot of us do it and still survive. And it was crazy, but I could work. He was in law school. I could work as much as I wanted to and make as much money. He was studying. It was perfect. It was great. He didn't have to work because my salary covered our bills. Because I worked a lot. I worked hard. I think the other piece of it, when I had kids, our first son, our only son, he had allergies and he would get sick in daycare. So he was in daycare for 3 months. We had 5 ear infections, 2 cases of strep throat, and the flu. And I was like, I'm done. So I went to working weekends only. My husband kept him on the weekends. I worked on the weekends while he worked during Monday through Friday. I stayed at home with our son. We didn't have to deal with daycare. And our son didn't have to have buttons in his ears. We didn't have to deal with all of those risky medical procedures because we were able to make it flexible with what we were doing.
And this was a while ago.
This was a while back.
So
it's
now
even
it's
more
even more
flexible. Exactly. Yeah. He's 23, so this has been a long time ago. We have, I had my 2 girls. We had one, she was premature. I needed to step out of the 24/7 on-call of a manager. I stepped into another role for a year. We had another baby, and you know what? She was fine. Life was great again. Let me get back into the management role. We wanted to go in. I went into education because it helped me be off when my kids were off. They were off all summer long. I wanted to spend time with my kids. They were young. They were off at Christmas. I wanted to be off during the holidays. I could do that in academics. In leadership, my kids are now growing. They're in college and out of college already. And I have the freedom to do what I'm doing and travel and come talk on podcasts. So there's a lot of things that you can do in nursing. And I think the flexibility and the ability to learn and enjoy each moment is something that you don't get in a lot of professions. And in nursing, it never is a dull moment.
Okay.
Never.
I will like to just point out those different perks that you enjoyed over your life, specifically for a nurse. I don't think they have that privilege, do they? Can they take, is it flexible enough that they can take Christmas off and things of that nature? Or is that because nursing gives you so many different opportunities that allow you to venture into these different areas, and that grants you those perks, but specifically with respect to nursing? So
bedside nursing.
Okay.
Hospital, is that what you're talking about? Hospital nursing?
I have a question actually.
No, go ahead.
What about do you get free healthcare?
Actually, it's really impressive. Great question. Great question. So it's based on the health system. The hospital I worked for in Louisiana, if I had anything at the hospital, it was paid 100%. Our child was in the NICU for 2 weeks, $50,000 bill. The hospital wrote it off.
Wow.
Pretty impressive. Not all hospitals have that system. Some hospitals say when you're within this parameters, we write it off. But every hospital has some benefit like that. The other piece of it is your providers really well. And, I had a surgery. I had to have a minor surgery thing done. And the surgeon was like, I'm not going to bill you for that. I mean, it was minor. It was not a lot of money for him. But he was like, we work together. I know you. You're a colleague. I'm not going to bill you for that. Okay. I'm not going to make you bill me for it. That's fine. I appreciate that. So, there are some really great perks with health insurance. A lot of hospitals, for instance, I had a friend who was a nurse practitioner. She worked for the hospital. And so anytime the employee and or any of their family members who were on their insurance plan went to this nurse practitioner, they paid $5. That's it. If she said, okay, you have to have lab work and I want you to have this x-ray, you still paid $5. So whatever she did, it didn't matter. You paid $5. And that's a huge benefit with healthcare prices the way they are right now. So hospitals generally always have phenomenal healthcare programs. Now, they do want you to use their services, and that's part of the benefits of knowing all the physicians and all the nursing staff and all the nurse practitioners and everybody. You kind of choose to have your colleagues take care of you, and that's usually a really great benefit too.
Mm-hmm.
Yeah.
Okay, so I would say, and these are major benefits, because for people that are getting into the careers, their life right now is just studying. And so they haven't gone through the grind of, waking up every single day and just going to work, coming back, and then spending time with your family and just the, how life functions. And so, I mean, having flexibility is a massive one.
Yeah.
And this generation cares a lot about that. Health insurance becomes a little bit more applicable as you get a bit older.
Yes, it does.
But
it's important.
Yes.
And people don't realize that health insurance is important across the board.
Very important.
No matter the age, because you never know when something's going to happen.
Well, so it was funny. I'm from Canada, and so we had free healthcare.
Right.
So when I came here, I'm telling you, I lost my mind. It looked like I was shopping for car insurance. I mean, I have a deductible, a max out of pay. Yep. Oh my God, it was just driving me nuts. Because I mean, in Canada, all you do is you have this one card, and you just show this card, and that's it.
Yeah.
And the government deals with everything. And
but you pay your taxes to help pay for it.
Definitely.
Right? So you're still paying for it. It's just
completely agree. Completely.
Yeah,
but
it's a little different.
But there's huge benefits to that centralized system. What I found was the continuity of care in Canada was very simple, right? My family doctor, everyone has a family doctor, by the way.
Right.
That's one thing that's very unique to Canada, because over here, not many people have family doctors. Right. And another thing that's really funny is you get the sniffles in Canada and you go see your doctor. Over here, people are like, nah, I'm not going to pay that copay.
Nope.
Which is kind of good, to be honest. But so there was a lot of pros. The Canadian system is very clogged up.
Yep.
And they are struggling post-COVID.
Oh, I'm sure.
Right. So anyways, we're not talking about comparing the systems.
I actually have former students who were Canadian who were in Canada working.
Yeah.
And that's one of the things that they had said is, one of them actually was diagnosed with a brain tumor in nursing school, finished school, and goes back to Canada for treatment. And she said it took 6 months to get my scan. And she was like, thankfully, it was totally operable and it was fine. And I just had to have it removed and everything went well. She said, but 6 months could have been it could have been life or death. And she goes, in the US, it would have been like 6 minutes.
Yeah.
And but you would have paid like $600 million, So there's some payoffs.
Exactly.
There really is. Yeah.
Yeah. Luckily, I got Kaiser. And so
Kaiser's good.
Kaiser's amazing. And the difference is I don't have to run to all these different companies just to use my insurance. Anyways, I don't know. This is off topic.
Yeah, but having somebody to talk about explain insurance, that
should be a job.
That I agree completely.
Right. And it's not a job.
An unbiased, non-salesperson for insurance.
Yeah. Yes, we need that here.
Yeah.
Create that job spec, please. I don't know who would pay for it though.
I don't know either, but it would be nice to have it.
Yeah. Because it requires a lot of research and it's really annoying. But okay, so now we've discussed perks. We know how many hours you work. There's definitely work-life balance.
Can be.
So I know you're very passionate about nursing.
I am.
And so what do you love about being a nurse?
I love the variety of everything. And I know that sounds kind of corny, but I don't like to be bored. In my whole life, that is one thing that drives me crazy is the moment I feel like I have mastered something, I don't need to do it anymore. Whether it was cross stitch that my grandmother was teaching me when I was little, or it's being a nurse. If I feel like I've mastered it and I feel very comfortable in it, I need something new to help me continue to learn and stimulate my brain. And so in nursing, I could maintain my competencies as a cardiac ICU nurse, but I could go across the hall and work in the surgical trauma ICU for extra money, an overtime shift to help my colleagues out and learn something new. I could go to the ER. I could do all of these different things. And I never felt like and I did a lot of this within one facility. I've only worked for 3 facilities in my entire career in 28 years. Well, one, I worked for like 9 months at a doctor's office and learned that was not for me. I think we all have to have those moments of, this is not going to be for me. But that's just because I was able to stay within the same organization. So you're building tenure within that organization, but you don't have to leave the organization to find a new excitement moment, to find that new opportunity. And I think that's what a lot of people right now are, I just think I need a new job. So they leave the organization and they don't think, what are all the opportunities within the organization? You don't have to leave. And I think that people miss out on that a lot and as a manager, we used to laugh and say, they're job hoppers. And that, they're at a job for a year and then they move into another one. And that's not a bad thing all the time, but people need that continuity of care, that constant similar policy, that everything changes when you go from one place to another. And you can never become an expert if you're constantly moving places. And so I wouldn't say that, do it for a year, but you can do anything for a year. When I went into management, my boss laughed at me when I hit my 1-year mark. And I said, today's my 1-year anniversary in this job. And I said, it's all downhill from here. And she said, oh my goodness, what do you mean? And I said, I promised myself I would do it for a year. Anything else is a little bit lagniappe, which in Louisiana is a little bit extra. That little cherry on the top kind of thing is what we mean. As I'm like, it's just lagniappe at this point. And she laughed at me and I was like, no, I'm really serious. If I quit at this point, it's totally because I chose to quit. If I stay, it's because I chose to stay. And she's like, are you quitting? I said, absolutely not. I love the job. So it's one of those things of getting in there and trying it. But again, if you get into an environment that's really toxic, I don't mean that you have to suffer through the toxic environment, but be the change that makes the toxic environment a great environment. Don't just jump ship because you're not happy today. Work through those challenges. That's what I love about nursing is the ability to create change and enjoy life.
Fair enough. Now, I know you're passionate about nursing, but there's got to be something that you dislike. So what do you not like about the profession or find challenging at least?
I don't like red tape. And nursing is a lot of red tape, whether it is charting and the type of charting and how you chart versus give this versus give this. Do you use this size needle or do you use this size needle? And everything is tied back to reimbursement. And that drives me crazy. I want to do what's best for my patient. If I need to worry about this little thing and this little thing, I just need to do what's best for my patient. But you have to worry about all the other things. If you don't make money, you can't continue to provide care. You have to have payment. You have to have that red tape to some extent. Sometimes the red tape is really important and it mitigates risk and it helps protect patients. Sometimes the red tape is just there to be red tape. And I don't like red tape. And I find like that's everywhere in healthcare is red tape.
I've seen a lot of bureaucracy as well. Yeah. And I love it. In the corporate sector, I admire infrastructures. I was just talking to my wife about this. I'm a nerd when it comes to infrastructures. Yeah. I worked at Capital One and I was just in awe at how well thought out and bureaucratic. I love it. They have so many mechanisms to ensure that things do not go wrong. Yep. And that gives you a lot of comfort. Right? Absolutely. Because I understand when you're the actual service provider, that's annoying, right? And don't get me wrong, it influenced me as well. Mm-hmm. It was annoying at times, but I appreciate it.
So don't get me wrong. I think there needs to be red tape, and I think there's important for processes, but I think it's too hard to change processes to be a better process. So if you see a problem, you can't correct it and say, okay, we'll make it better next time. It's bureaucratic tape to find that solution. So, whether it's a type of research that you really see this problem and are like, well, we don't think that's a problem. Well, all of our literature says this. And I'm like, but in this patient population, this is a problem. And, we don't think it is. But now let me prove it. Let me do the research and prove to you that it's a problem. So it's more of, it's a constant, ever never ending proof that it's good process, right? Does that make sense?
I get it.
Okay.
I get it.
I mean, I'm the ICU nurse in me says, oh no, it needs to be organized. It needs to be very straightforward and clear. But so many, we found that so many times we knew what needed to happen for the patient and we knew what needed to happen for the family, but to get where we needed to go, it took 6 layers when really it should have taken 2.
I get that.
And that's stressful.
I get that. There's pros and cons.
There are.
I stick by it. I like red tape because I've worked in places where there is none and it's disorganized.
Well, that would drive me crazy. I don't do chaos.
And it's typically correlated with a lot less resources.
True.
Everyone's competent. I don't think you find competency in small places, medium places, big places, but the resources and bureaucracy, they typically come together.
That's
right?
true.
So,
that's true.
Anywho, so your journey has many tangentials. And so you're a very good candidate for this. What are some tangential roles in nursing that you may want to explore? For example, once you enter this field, what are some other jobs and careers that just pop up naturally? And do people typically stay as a registered nurse for their whole life? Where do they, how would you recommend people venture out in the event? Suppose they practice it for like 4 or 5 years. So I'd like to know both, what are some tangential fields that can pop up? You yourself have like a few that you've explored.
Yeah.
And how would you recommend somebody else go into it? Because my wife, for instance, she's a data scientist. And so there's a lot of nurses that go into data science after. And that was interesting for me to learn.
We're very numbers driven.
Yeah.
And so we are, whether it's patient labs or patient vital signs or there's mechanisms of care, we're very numbers driven. And so we do see a lot that go into data scientists. We see a lot that go into research. That tends to be that more left side brain person who tends to want that. And that's kind of why I like research, is I'm very organized in my thought process and I love numbers. It's also why I have an MBA. Like I said, I'm a complete dork. And
So just a note on this.
Yeah.
So you have an associate's degree.
I do.
You have a bachelor's degree. You have a master's in nursing as well.
I have a master's in nursing and
you
an MBA.
have an MBA. And what else?
I did a postgraduate educational specialist. So it's like a post-grad pre-doc. I have my doctorate is in education, and I have a couple of different certifications as well. So I'm a certified nurse educator, and I'm a nurse executive advanced board certified.
So you pretty much spent half your life in school.
Yeah. So I went to school. I graduated at 21 from my associate's degree. I went back and graduated. I took a couple of years off when my husband started law school. I went back almost 3 years later and finished my bachelor's degree in 18 months. I took time off. We had kids. So I was 25 when I graduated with my bachelor's. I was 35 when I graduated with my master's, and I did a dual master's. So my master's is in nursing. My MSN is focused in healthcare administration, and my MBA is healthcare administration focused. So I did that as a dual degree. So it's a double master's when you graduate. So it took 3 years. So I started, our youngest was 10 months old when I went back to school and did that. So being a young family, you can still go back to school. And I finished that one after she was 3 when I finished that one. And I took a year and a half, almost 2 years off. And I went back and started my doctorate. And I like having short-term and long-term goals. So I did the EDS, the educational specialist, in about 2 years. And then I finished my doctorate 2 years later. And then in the midst of all of that, I sat for my certification exam for a certified nurse educator, which is a very hard test. So this is like the nursing instructors that write the exam. So this is like the hardest of the hardest kind of test, in my opinion. And only like 63% 68 maybe now, pass it the first time around. So I felt really good. I'm a decent test taker, I'll be honest. I feel pretty good about taking tests. During COVID, I said, I need something to do. I want to learn something new. So I sat for my nurse executive advanced board certification during COVID because I needed to do something new. And I don't waste time. I don't like to sit still. So yeah, that's what all those letters behind my name mean.
Fair enough. Incredibly educated at the very least.
I enjoy it. I enjoy learning. I've said that. So it's learning with a goal. Yeah.
That's cool. So back to the tangential roles. So we talked about data science. Obviously, you can go into hospital administration. Nurse practitioner was a role that popped up. Are there some other roles that are more closely linked to nursing that people explore?
Yeah, CRNA, the nurse anesthetist. So CRNA and nurse practitioner are considered advanced nursing practice. So this is like you get a registered nurse, like you go to school, you get your bachelor's degree or your associate's degree, you get your registered nurse, you have to have a bachelor's, then you go in and get your doctorate or your graduate degree in nurse practitioner or CRNA. So that's more clinical. So your clinical roles are registered nurse, and in that RN, you can be in the hospital, you can be in a doctor's office, school nurses. They do cancer treatment centers, community health, and community activists. A lot of times nurses are very involved in that. We have some RNs that sit in Virginia on the House and in the Senate. I think we have 2 people that are registered nurses in the legislation. Most states have, there's 1 or 2 at the federal level that are registered nurses as well. You can work for nursing organizations. I have a really good friend of mine who I work with the VNA, and she worked in the hospital for several years, and now she works from home for the Virginia Nurses Association. It works great for her and her family, and she is doing a fantastic job leading that piece of the organization. So you can look at those organizations, and it's a wide variety. Every subspecialty has an organization. Some of them have employees and some of them have volunteer. I volunteer for the VNA. I was elected in that role. And some people have pure volunteer roles. Some people have these elected and some have employees. And each role is a little bit different in what you're doing for that. You can see nurses in academia, of course, everything from teaching CRNAs or teaching CNAs, the certified nurse aide, all the way through teaching into the doctoral programs at the PhD or the nursing practice doctorates. You can see nursing right now. What I'm doing is helping to build a pipeline for healthcare providers. So one of the things I'm doing, I am currently the provost and executive vice president for academic affairs for a K-12 institution. So I switched over from higher ed into K-12. And one of the things that I did with kindergarten through 12th grade, so your primary, secondary education, was create a pathway for high school kids who think they might be interested in healthcare. So I worked with one of my colleagues at a university, a 4-year university, to create a associate's degree in liberal arts that has a focus on healthcare. So they come in and they're able to take anatomy and physiology, they're taking biology, they're taking all of these classes at the high school, or they're taking it at the university, and we're backfilling it into their high school classes. So it's an opportunity to build that pipeline of future healthcare providers at that high school level. So that's where we have to get creative to build the next generation because we're on such a shortage right now. So this is one way to do it.
Here you are on the podcast.
Yep, here I am. So, nursing you can do almost anything. There are nursing entrepreneurs that are doing some amazing things out there. There's a comedian, and I won't, advertise for him, but he's a nurse and he's hysterical, and he's going around doing stand-up comedy. He has YouTubes and TikToks and whatever else he's doing, but he's absolutely hysterical. He's not wrong. Some of his stuff is wrong, just in that I cannot believe he went their route. But some of it's just downright hysterical. Nurses, we have nurses that work overseas. I have a colleague of mine who started a school in Togo, Africa. And she's teaching the next generation of nurses in Togo. I have a former student who is in the United Arab Emirates, and she is the very first nurse practitioner in their country. And she's helping to build that practice of what that would look like there. So nurses can go anywhere. You can do anything with a degree in nursing. Anything.
Diverse career.
You can be a lawyer. You can be a judge.
I don't recommend that much studying. It seems like way too much studying.
That's a lot of education. Yeah. That is. I keep waiting for the first nurse to be president. So, we're still holding on for that one.
Anything's possible, right?
Well,
so now that you have so many years of experience, but your experience is all over, you have a diverse set of experience, specifically with respect to being a nurse. let's try to picture you just starting your nursing career. What advice would you give to yourself that you didn't know when you started off and you wish you did know?
Yeah. Yeah. I think it is important, and you're going to laugh again when I say this. I think it's time to breathe. As a new grad, I was so worried about learning and being the best that I could be and working because I didn't understand the longitude of the career. I didn't understand all of the capabilities. I needed to breathe. I, at one point, was working 2 different jobs, and I really could have solidified it down to one and been just as happier. I think a lot of times new graduates are trying to make so much money, which I appreciate. They have big student loans, and if they need to do it that way, I understand that. But you have to breathe. You have to take care of self. You have to learn to fill your cup, so to speak, so that you can help others. And if you're not taking care of yourself, then you're not at your optimum to help take care of others. And I always laughed and said, it's we're terrible patients as nurses. We're absolutely horrible patients. We're worse than doctors. We really are. We're bad. But if I'm trying to give advice to my patient, I need to be able to live that life. I need to be able to say, I've been there, I've done that, and here's how I succeeded, or here's what I've learned over my years. So I think that there's that moment of taking a breath. And I think in our society in the United States, our culture is so driven. It's go, 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 and take a deep breath and go again. And I think sometimes we need to really slow down and take some cultural influence from our colleagues around the world of just breathe. It's okay. Just take a breath and slow down a little bit. I think that that's important. It's good. I think we need to engage and be engaged. And I think I say that because nurses need community just like everybody else does. And I think COVID taught us that more than anything else is people are communal beings, and we need to be with people. And so engaging in that group and being a part of that team is very important. And nobody ever really told me that. I had to learn pretty kind of hard. I'm a pretty independent person. I'm a pretty go-getter and make it happen. And I realized I was more intimidating to people than I realized. And it was never intended to be that way. I never meant to do that. I had one nurse that I worked with who told me, she goes, "You sit up too straight." And I was like, "What are you talking about?" She's like, "People are intimidated by you because you have great posture." And I'm here slumped in your chair today, but up until she said that, I was like, you're right. I really do. So let me help kind of relax a little bit, because I tend to be a little bit formal. And I think a lot of us can be that way. And so learning to be human is important. And I think it's okay to let each other know you're struggling. And the first patient who died on my watch, I will never forget her. I still see her face to this day. I sat in the break room and I put my head down and I cried. And I'm a pretty tough person, but it impacted me. And it was the whole situation was just not a good situation. And it broke my heart. And it was nothing that it needed. I don't want to say it needed to happen. That's not the right words, but it was nothing I could have done differently. There's nothing that could have changed the outcome. But you, as a nurse, you still go back and you tick off everything. Did I miss something? Did I not see something? Did I do this right? Did I do that? And you can't necessarily blame yourself all the time. You have to be super vigilant so that there aren't mistakes, but you have to breathe and say sometimes life is just bad, and sometimes there are just bad outcomes, and not blame self all the time.
That seems like really good advice. That's deep.
It's hard advice to swallow sometimes.
Okay. Why would you say certain people fail as nurses? Because I don't know why there's been an interest in that question.
Yeah.
So why do people fail as nurses?
We see about 25% of nurses leave the field within the first 5 years of working. That's a huge percentage of people that just leave the field. I'll never forget when I was in nursing school, I was working with a nurse on a floor, and she goes, "Yep, today's my last day." And I was like, "Oh, where are you going? What are you going to do?" And she goes, "I'm going to be a truck driver." "You're going to be a truck driver?" And she goes, "Yeah, I'm tired of nursing. I don't want anything to do with it anymore. I'm going to go drive trucks with my husband. He's a trucker, and I'm going to go be his partner. So I'm learning how to drive a big rig." I was blown away by that. And it put me on that journey of realizing that nursing is hard. It's hard work. It's mental, it's emotional, it's physically exhausting. And I think COVID has made that even a bigger spotlight on nursing for that reason. I think we're also sharing our feelings a lot more on social media than we did 15 years ago or, even just 5 years ago. And so we're more aware of it right now. I think the biggest thing is they don't find that sense of community. They don't have somebody to talk to. They don't have a mentor. Every new grad nurse must have a mentor. They need somebody that will be honest with them, that will call them out when they're pouting. I don't mean that to be bad, but you get into a funk and you're just exhausted and nothing's right. Oh, they hate me and I hate them and I'm going to go pout in the room. And I think that you need somebody to say, you know what, you're being a little silly. You had a rough day. Now let's pick up and let's move on. What can we do to help you move forward? And I think every new nurse needs a mentor. I think it can be a fellow nurse. It can be a former educator. It can be a retired nurse. You just need somebody to talk to about those emotional and mental moments that you just want to crash. My sister's a registered nurse too. She didn't become a nurse until she was in her late 30s. She's actually finishing up her PhD. She's in her dissertation phase right now. And I'm her person. So when she was learning in nursing school and in those first couple of years of nursing, she would call me and just vent. And I was the person who could say, oh, yeah, you're right. It's a bad day. It is really bad. How are you going to make tomorrow better? So it's focusing on that positive. And when you're inundated with negative, you don't see the good. And when you fail to see the good, you become discouraged and hopeless, and we leave the profession. So it's always been my mind as a nurse leader, as a nurse educator, as an administrator in various roles, is to always see what's going good. We have to deal with the bad. We have to deal with whether it's a toxic work environment, whether it's a broken process. You have to deal with that. But can we celebrate the really good and helping focus on that positive so that your mind is in a state of goodness? And I think that is a huge thing that we're missing in nursing right now. I think we have a professional dilemma right now. To be honest, we are not recruiting as many people into nursing. We're not maintaining nursing. People are leaving the profession. We are overworked and underpaid if you talk to a lot of us. And so what do we do good? What do we do good? You know what? Nurses are some of the best patient advocates. Nurses are some of the best teachers. Nurses are some of the most engaged individuals. And so let's focus on those positive moments. And everybody needs somebody that can help them see the positive and the good in life.
Fair enough.
It's a lot for that question, isn't it?
Well, I understand, there's always the fear of failure.
Always.
Which is why several people, I asked people, give me some feedback with respect to the podcast.
Mm-hmm.
What do you want to know? This and that. On multiple occasions, I heard people say, why do people fail in this profession?
Yeah.
And so they're concerned. When you're young, you kind of care about those things. You don't realize that it has nothing to do with intelligence. It's just a difference in experience.
Yeah.
And it takes a few years to get that.
Absolutely.
And so that's what I always tell everyone who's starting off in the profession. Yeah. It's that, hey, I'm not smarter than you. It's just that I've had the opportunity, few more years of experience. Yeah. I've got a lot of reps in with respect to whatever you're practicing. Mm-hmm. And the difference between you and I is literally just reps.
It's experience.
And so, as long as you understand that, you'll be all right.
Yeah, we used to say that it takes 3 years to become a good nurse. Mm. And so by the time you're really a good nurse at 5 years, you shouldn't be leaving the field. Yeah. And so most of the time you see it's that 3-year mark of, I feel like I should be doing so much better than I really am, but they're still so young. And yes, you passed state boards, but just because you passed boards, that's minimal competency. You graduated, that's minimal competency. You are still not going to be a strong, good, amazing nurse for 3 to 5 years. Mm-hmm. And we've got to find a way to build them up during that time and not allow them to become so focused on potential failures that they miss on the great successes that they're accomplishing.
Fair enough. Yeah. So I close off all my podcasts with asking each and every single guest, I want a short answer. What is the best career advice that you've received? I'm looking for a line.
Okay.
And what is the worst career advice that you've received? Okay. And we can talk about more, but I'm looking for, I always keep saying this, that I'm going to do this and I'm going to prepare my guests in advance, make them write it down. So I should have done that, but I forgot. Got to add that to my checklist.
So worst career advice, I'll start with that. Just hang in there. That's terrible advice. You can't just hang in anywhere. When you just hang in the air, you're going to fall. When you're just like the cat on the side of the cliff and you're hanging in there, but you're going to fall, you're going to get exhausted. So just hang in there is not good advice at all. When things are falling apart, just hang in there. No, you need help picking up the pieces. I think the best advice I ever received was from a CNO, a chief nursing officer that I worked with when I first became, it was actually right before, it was when I was manager. So it was right before I became a director. And Christine looked across the room, and she and I are still really good friends. And she looked at me and she said, "You're stepping into leadership, and all nurses are leaders because somebody is always watching what you're doing." She says, "But you're going to become a leader, and you're going to now, your role is to make sure that those nurses have everything they need to do their job." And that is from a leadership perspective, but that advice alone helped me realize that as a nurse, my job was to make sure my patient was good. As a nurse leader, my job was to make sure that my nurse was good so that his or her patients were taken care of. As a nurse educator, my job was to make sure that the future nurse was prepared to take care of those patients, or the future nurse leader was prepared to take care of those nurses, to take care of those patients. And so her single sentence of that has echoed through my entire career. And Christine is still a CNO, and she has done some amazing things and worked at some of the most amazing hospital systems and turned hospital systems around from a nursing division perspective, because her whole goal was keeping her eye on the patient. And what do? We focus so that the patient is taken care of. And it takes our eye off of the what do I need to what do they need. And that, it echoes through, and it's still, I have it written on my desk, and it's a I don't know, it's a poem. I wouldn't call it a poem. It doesn't rhyme, but it's just that statement of what am I doing now is what I'm doing for the future. And so you see your impact when you think of it that way.
That's cool.
I know it's not quite one sentence, but
No, that
it's
one was
close.
good.
It's close.
That was awesome. Well, thank you so much. I think anyone that is thinking about the career of a nurse will definitely find this episode very, very helpful, very useful, because from an education perspective, career perspective, and venturing out perspective, you're able to offer so much insight. So thank you so much for
Absolutely.
driving all the way here.
Oh, it's been a pleasure to talk.
I
love
appreciate
nursing.
it. And I look forward to posting this, and hopefully you get a lot of nurses.
Absolutely. We need more. Come more. Everyone needs to be a nurse.
Awesome. Thank you.
Thank you so much.
Well, that's it for this episode of the My Career Shop podcast. Thank you for tuning in, and I hope you have a better idea of how to become a nurse and what to expect when you actually become a nurse. Details about this episode and the career of a nurse are on the My Career Shop website, links to which are either in the description below or show notes based on where you're watching or listening from. If you haven't already, please hit the subscribe button, leave a review, and comment on what professions you want me to invite next and what other information you'd be interested in learning. See you soon.